We're just going to wait a couple more minutes, waiting for a few more people to join, and we'll get started in a moment. Hello, everyone, and welcome to the Call to Action Annual Partners Meeting. My name is Katarina, and I'm Canada's main focal point for the Call to Action. So during the opening session, I'll just go over some housekeeping and the agenda to get us in order, and then we'll hear opening remarks from Canada's Minister for International Development and Canada's Director General for Humanitarian Assistance. This session will end with a video featuring remarks from high-level speakers and local women's rights activists. First, we are offering a simultaneous English and French interpretation during the meeting. So Juliette, Michelle, and Michael are translators over the next 3 days. To listen to the meeting in another language, please click on interpretation and then French or English at the bottom of your screen. Nous offrons de l'interprétation simultanée en anglais et en français au cours de la réunion. Pour écouter la réunion dans une autre langue, veuillez cliquer sur Interprétation, puis sur Anglais ou Français dans les commandes de la réunion au bas de votre écran. Please feel free to speak in English or French during the meeting. Second, if you haven't already done so, please set an out of office like you would with an in-person meeting so you can be fully present. Third, let's go over how we'll be communicating throughout the meeting as we have a lot of participants on the line. So if you would like to ask a question to one of the speakers, please use the Q&A function. Speakers, you can respond to a question by answering it verbally to the group, or you can respond directly to the person in writing. During discussions, we ask to ask a question or to make an intervention. Please use the raise a hand button and you will be unmuted to speak. So as attendees, you are currently all muted automatically. If you're not called upon right away, please note that we're doing our best to get to you. And if there's a large number of people, it might take a little while. On that note, if more than one person has joined from your organization, please have your call to action focal point be the main spokesperson for your organization. We've left the chat function open as well, so you can react, comment, and share ideas with other attendees. Please do not use the chat to ask speakers questions because in case it gets very busy, it might be difficult for them to monitor and they may not get to your question right away. So fourth, if we were having an in-person meeting, we would have our nameplates. So please set up yours electronically with your first and last name, followed by your organization name. Given the concise nature of this year's meeting, we will not be doing a round of introductions at the beginning. Further, please be advised that these sessions are being recorded for future reference internal to the call to action partners. So if you disconnect or have a weak connection, you'll be able to revisit these at a later date. If we encounter any technical difficulties and are forced to restart the meeting, please connect again using the same link, ID, and password that you've been provided with. In case of any major setbacks, we'll email you a new Zoom link to the email that you registered with on Eventbrite. Finally, Joan from the Women's Refugee Commission will be moderating the transitions between the sessions after the opening remarks. We are also going to be using a polling feature to engage partners on particular questions throughout the meeting. So when you see a poll question come up on your screen, please answer it right away because it won't be up for long. So actually, let's give it a try right now. Olivia, if you could launch the first poll question. All right, so here are the results. We do have a lot of new people to the call to action and quite a few that have been with us for a while. So we look forward on drawing the expertise on those who are very familiar with the call to action and hearing new ideas from from those of you who are joining us for the first time. Welcome to all. And we're going to do one more poll question at this time. Olivia, if you could just launch the second one. There we go. And I realize most of us are working from our home, so that can either be headquarters or regional, whichever office that you work for. All right, so most of us are from headquarters. I realized at the last call to action meeting, I think even there was even a bigger difference. So we are really looking forward to drawing on the expertise from those that are joining us from the regional, country, and local offices. Again, welcome to all. All right, so now I will just briefly go over the agenda and what we can expect over the next few days. And to start, this isn't really the first day of the meetings because a number of you have been participating on the online forum over the past couple of weeks. So I really like to thank for your engagement to those who have been a part of that. And to note, we are going to be keeping the forum open and throughout the meeting. So actually maybe after today's Zoom meeting, I encourage everyone to go on the forum and to have a look at the questions on there, to make a few posts. It will make the moderators of the strategizing by outcome sessions on Friday very happy if you could engage on that today. And as for the agenda, so after our opening segment, we are going to have a session on advocacy. We'll have a 15-minute break, another session on resource mobilization. We'll have an hour break, and then we're going to have a side event on COVID-19 and beyond, a feminist approach to gender, food security, and the economic crisis. Tomorrow, we're focusing on the field. So we're going to have a session to refresh us on the Gbv accountability framework. And after the break, we will dive in deep into the field implementation strategy and what we can do individually, but most importantly, collectively. On Friday, we're going to have the strategizing by outcome segment. And after the break, we will coordinate amongst the working groups on any joint priorities, and we'll have very brief closing remarks. So that's it for the agenda. And continuing on with our opening segment, it is now my absolute pleasure to introduce a video message from Canada's Minister for International Development, the Honourable Karina Gould. She's a passionate advocate for women's rights issues and has been instrumental in advancing the key messages of the call to action, particularly most recently calling for strengthened focus on Gbv in the COVID-19 response. So I'm just going to start the video.
I would like to offer a very warm welcome to all the partners of the call to action. Like everyone else, we are learning to do things differently since COVID-19 swept into our lives in March and changed how we do business. Many of us are doing what we do while sharing space with young children, for example. I am in awe of how people have been able to combine parenting with their work in the world. It has had a humanizing effect to not compartmentalize our roles, even though it has been challenging. The fact that we already have working relationships and a shared commitment to doing something about protecting women, adolescent girls, and vulnerable groups is what makes it possible for us to come together like we are today and spur each other on to action. For many of us, home is a safe space. However, for the most vulnerable among us, the realities of COVID-19 have put them at an increased risk of abuse and led to what UN Secretary General Antonio Guterres calls a horrifying global surge in domestic violence. The rise in gender-based violence has made the work of the call to action more important than ever. If we do not put the needs of women, girls, and children front and center in our response, we not only risk losing the important gains made in these areas in support of Agenda 2030, we risk losing even more lives. We must not let this crisis take away our chance to rebuild more inclusive, secure, and resilient societies. And the humanitarian community has risen to the need, preventing, mitigating, and responding to gender-based violence. You have been on the front lines of making sure that our response to COVID-19 addresses the needs and priorities of women and girls, especially the ones living in crisis situations. Because of your action to come together and issue a joint statement on gender-based violence and COVID-19 to influence the global humanitarian response plan on COVID-19, I was able to share and reinforce this powerful statement as a priority with the heads of UN agencies, the ICRC, and the IFRC. And all of us are stepping up to the UN Secretary General's call to put the safety of women and girls at the center of our response. It is my pleasure today to announce $61 million in funding for 2 projects to help prevent and respond to sexual and gender-based violence in Syria, Iraq, Jordan, and Lebanon. At the country level, $57 million will go to the United Nations Population Fund to meet sexual and reproductive health needs of women and girls and respond to sexual and gender-based violence. UNFPA will be able to use this funding to provide emergency obstetric care and SRH services and to protect women and girls from gender-based violence. It will also be used for health services, supplies, and medication for crisis-affected people. The other $4 million will be used at the regional level for SGBV and SRHR coordination and humanitarian responses across the Middle East. Among other things, it will build the capacity of frontline, local, and national workers in sexual and gender-based violence. In the end, it will lead to lives saved, alleviating suffering, and maintaining dignity. If you have advice for political leaders and ministers of international development, like me, on how and where we can use our voices to amplify awareness and action to help end gender-based violence in emergencies, you have my ear. I am listening. I am very pleased to see all the work you have put into the next 5-year roadmap, and I'm very grateful for your dedication in continuing to deliver life-saving gender-based violence services to advance humanitarian action. It is not an easy road you have chosen, so thank you for your work. This call to action initiative brings together states and donors, international organizations, NGOs, and local civil society organizations. This unique partnership will serve you well over the next 3 days as you address the challenges ahead. It will take determined action by all of us to change the situation. As you look ahead to imagine the world you want to see for women and girls in humanitarian settings, I urge you to be brave, to be bold, and to be visionary. Leave nothing out. I look forward to the public launch of the roadmap in the fall. Thank you.
So I hope that message would inspire us all to work hard over the next 3 days to figure out how we can best achieve the outcomes under the roadmap. Next, it is my pleasure to introduce you to Stephen Salawitz, the Canada's Director General for Humanitarian Assistance. Stephen, over to you.
Thanks so much, Katerina, and good day to everyone, and welcome to the annual partners meeting. I'd like to thank everyone for your patience and adaptability. It certainly is a challenging time for us all. We would have loved to have hosted you in Ottawa this year, but I'm really confident that you'll be as productive in mapping the way forward through this virtual meeting as well. I'd like to say a few words on the call to action roadmap. First, I'd like to give a big thank you to Joan Hen and Rahima from the Women's Refugee Commission, who put in hours upon hours in producing the updated roadmap in consultation with all of you. Second, I'm really happy that we've reached consensus on the roadmap through the various rounds of review. It is important to also acknowledge, I think, the foundational work that many of you as original members of the call to action put into drafting the original roadmap. It was this solid foundation that really lent itself to the successful update of the roadmap and to the success of the call to action to date. The roadmap builds upon the existing one and strengthening the focus on gender equality, the empowerment of women and girls, and localization. It builds on the achievement of partners from the first roadmap and incorporates lessons learned and best practices. Thank you so much, everyone, for all the work that has gone into focusing and improving this next iteration of the roadmap. As we know, the next step for all of us is to reaffirm the roadmap and to make our bold commitments. By reaffirming, you agree to the goal, objectives, and core principles of the call to action. You will all receive reaffirmation, guidance, and a template for making commitments next week. I hope the discussion from this meeting and reflection in the next couple of months will help you with identifying your commitments. We hope to publicly launch the revised roadmap on the sidelines of UNGA in September. This will be the first opportunity for you to announce your commitments publicly, and I encourage you all to do so at that time. Once again, thank you for your dedication, particularly throughout these challenging times. I'm wishing everyone a safe and constructive meeting over the coming days. Thank you. Over to you, Katerina.
All right, thank you, Stephen. And to close our opening segment, I would like to play one more video for all of you. I hope it sets the tone for the rest of the meeting and grounds our discussion and how we can best respond to the needs of women and girls together in emergencies. So one more video coming right up.
The call to action on protection from gender-based violence in emergencies is a groundbreaking global initiative. We are proud of our accomplishments, but there is much more work to be done, especially during these unprecedented times. As members, it is through our collective action and voices that we seek to drive change and foster accountability, so that every humanitarian effort from the onset of a crisis like this one addresses gender-based violence. The prevention and response to gender-based violence matters and is essential to building a more inclusive world for women, girls, LGBTQ2I persons, and other marginalized communities. It matters because it not only saves lives, but it is at the root of upholding universal human rights and the values that we hold as an international community, values that we rely on to unite us now more than ever.
Addressing gender-based violence in emergencies matters because in every emergency, rates of violence increase for women and girls. COVID-19 is no exception. We don't have to accept this. Let's demand a new normal where GBV is a thing of the past.
Preventing GBV matters because GBV is an extreme violation of human rights. If we want to achieve full gender equality, we need to end all forms of violence in our societies.
And we know that this violence is preventable. The UK's What Works to Prevent Violence programme demonstrated that even in the most challenging settings, we can reduce violence by up to 50%. Any delay in putting in place measures to prevent and respond to GBV exposes thousands, possibly millions of women and girls to unacceptable suffering. I'm determined that the UK will continue to play its part with others in scaling up global action to end violence.
I'm very proud that my government, since 2013, is part in this important call to action to prevent sexual and gender-based violence. We believe that every day, everywhere, it's important to prevent it. And in times of emergencies like COVID-19, it's very crucial. It's at these times when people lose their resilience that they need this action most. We are not alone in this call. Many partners, many countries support it, and we can give a voice to the people that don't dare, the millions of women, girls, men and boys that are too scared or too ashamed to come forward.
Mitigating GBV risk matters because it saves lives from the damaging consequences of all forms of violence.
It can help save lives of many women and girls.
Providing specialized gender-based violence services matters because it can help GBV survivors to recover their human dignity and self-esteem.
They can be life-saving to many women and girls around the globe and grant sense of agency, protection, dignity, and real empowerment.
It gives them hope and restores hope in their families.
Empowerment of women and girls matters because it enables them to unleash their potentials and address these barriers. Empowerment also taps the power within of women and girls to protect themselves, their communities, from all forms of discrimination and gender-based violence.
Because it will give them power, strength, and weapons to face and overcome their trauma.
Because a safe and prosperous world matters. That is why we are committed to putting women and girls at the center of humanitarian action. We know that refugee women and girls face unacceptable risks of gender-based violence when they flee and throughout displacement. This is especially true during the global pandemic. Together, we will fundamentally transform humanitarian response to GBV and to gender inequality. Together, we will make a difference.
This call to action matters because human rights are women's rights and women's rights are human rights, and therefore violence towards girls and women is a violation of human rights, and we have to act now.
Our work is long from finished. We need to continue advocating for better responses to gender-based violence from the start of any crisis. This cannot wait. As European Commissioner, I'm looking forward to continue our collective work.
Because it unites our common and global fight against this terrible type of violence, gathering states, international organizations, and civil society organizations. It is important to stand united to protect people at risk of GBV, to provide sexual and reproductive health services, and to prevent the impunity of these atrocities.
It helps us meet our collective obligations to women and girls. Thanks to Canada and other distinguished partners for leading and promoting call to action and to develop the new roadmap. It is my hope the new roadmap provides clear accountabilities to all the leaderships and decision makers that prevention and response to gender-based violence must be our top priority for life-saving and the future of our society.
CARE has been proud of the work undertaken by the call to action to date. We must now redouble our efforts to hold ourselves accountable to the commitments that we make at the global level to ensure meaningful change for women and girls where it matters most.
Call to Action's new 5-year roadmap makes every one of us accountable for this across the entire international system. UNICEF is proud to stand with you at this important effort, and we encourage all our partners to help bring this accountability to life at the field. Let's transform the humanitarian system to deliver for and with every woman and girl. Let's end gender-based violence. Let's create a new normal.
Canada is proud to be the current global lead of the call to action, working alongside these partners. The strength of the initiative lies in its diverse membership and its collective action. I call upon all partners to make bold, ambitious commitments for the next 5 years to support the updated roadmap. Together, we can end gender-based violence in emergencies.
So I hope you all enjoyed the video, and we still have a few minutes left before the next session on advocacy. So if you have any questions, please raise your hand or send it through the Q&A function. And if it's an IT question, don't ask me this. Olivia would be more happy to assist you with any technical issues. So let's open it up. Any comments or questions? If there aren't, we could always start early on the advocacy session, but I'll just give it 30 more seconds for any reactions. right, I see someone raise their hand. I'm trying to get to you. 1 second. Okay. Go ahead.
Hello, Katerina, can you hear me?
Yes, we can hear you.
Thank you very much. Good to see you again. Thank you for the powerful video that you just played. In view of the high rate of gender-based violence in Nigeria, I was hoping that I would see more male voices speaking out on the need to face gender-based violence and wipe it out. In my country, particularly in the northeast of Nigeria, we need more male voice advocates against GBV, because each time the men keep hearing the women talk, they can easily dismiss it as women talk. But when we have more male advocates talking and emphasizing the need for us to stamp out GBV, it does more in the fight against GBV. So while the message has been good, could you consider next time doing such a video if you could include male voices, more male voices, particularly from high GBV countries? Thank you.
Thank you, Yusuf. And yeah, we definitely need to engage men and boys in the conversation, and we're very happy to have you be as part of this meeting and to raise this issue as well. Thank you. Are there any other comments or questions? All right. Well, let's see. Great. So why don't we get started on the next, oh wait, there's a few Q&As. Okay, so we do have a couple of questions in the Q&A. The first one was, is there a way to see the participant list who is here? So we are currently in a webinar and we have over 100 participants on the line. So the way this is set up, unfortunately, as an attendee, you cannot see the participant list, but we do have, I believe, like most of the call to action partners here, as well as some local CSOs as well. And then there is also a comment from Malika saying we need to aim to end GBV everywhere and not only in humanitarian action. And yes, of course, important to, and it's a global issue that affects all countries, and definitely need to end it everywhere. But as the call to action on protection from GBV and emergencies, we're hoping as a group here to make segue on this issue in emergencies as well. All right. I do not see any additional questions or raising of hands. All right, maybe we have a shy crowd for now, but I really hope we are going to have very engaging conversations. And once we get into the different sessions, please don't be shy. Raise your hand. Or write in the Q&A. It'll be great to hear your views. And the meeting is going to be we want to engage everyone and to figure out how we can move forward and what we can do next. So looking forward to active engagement. And with that, I'm going to give it over now to Joan to be moderating the transitions between the different sessions. So Joan, over to you, and everyone, I wish you a very productive meeting. All the best.
Thanks, Katerina. Hi, everybody. It's great to be with so many old friends and also so many new friends, right? And I think would that we could be together. We all want to do that, but maybe we can make this the liveliest Zoom session we've done in these last weeks, right? I also want to say special thanks to Canada, not only for that inspiring start, but really also for the leadership of the call to action over the last year and a half. I think we all very much appreciate that, and as a collective have really benefited from it. Our first session is advocacy. And I think this is probably a great session to start with, because I doubt that people will be shy during the advocacy session. There are a lot of advocates on this call, and I think we can count on a lot of participation. I also think it's quite fitting that we're starting with advocacy, because this is an area where the call to action really has significant added value, right? Where we really can and must actually use the leverage our power as a multi-stakeholder initiative to better address GBV. So key to what we're all about under a call to action. So it's an area where we do have significant added value. I think it's also why, as many of you know, advocacy is now included as a key action under every single outcome of the roadmap. And I think that speaks to the particular added value that call to action brings on the advocacy front. So with advocacy being now in every outcome of the roadmap, I think that makes this morning's conversation especially important, or all the more important. So I'm going to turn the microphone over to Lena Minshew from IRC, who is going to lead us in what I am confident will be a sparkling conversation. So thank you all. Lena.
Thank you, Joan. As Joan said, this is Lena Minshew from the International Rescue Committee, and I am really excited to be leading this first working session for the call to action on protection from GBV and emergencies. And I'll just echo Katerina and Joan's calls that we hope this will be an active session and that you'll be able to engage. We'll be monitoring the Q&A and the chats as much as possible. So I'll just start us off by basically saying, as we know, gender-based violence in all its forms is increasing along with the spread of COVID-19. And while this work has always been critical and life-saving, I feel that our collective work to prevent and respond to GBV, whether that's intimate partner violence, child early and forced marriage, or sexual violence, it really feels like it's never been more important. So as we get moving into this advocacy session, which can sometimes feel quite far from the women and girls that we seek to serve, I know that I will personally be trying to keep my attention on the women and girls that are facing violence at this very moment, and using that to infuse hopefully some added passion and engagement into this. So on to the session. In the last 2 years, I feel that we've really moved the call to action advocacy from talking about what the call to action is and why groups should join, into calling now for more specific actions as a collective, particularly during key events. The first type of activity like that was just about 1 year ago at the Oslo End GBV conference. And since then, we've been able to release statements on COVID-19, the Beijing +25 process, and for the Global Refugee Forum. These statements have been released by Canada on behalf of the call to action and live on the call to action website. If you look under the, I believe it's the reports section. Luckily, though, they don't just sit there after they're developed. For instance, as you heard from Minister Gould in her video address, our COVID-19 statement was brought to the attention of key decision makers, both within and outside of our partner organizations. And in addition to the minister's work, the statement has been brought into meetings like the recent ECOSOC Humanitarian Affairs segment, or the ECOSOC HAS, which had a high-level panel on GBV that was hosted by OCHA and a couple of other partners, including Norway. So in today's session, we have about an hour to discuss the next steps or the next phase of our advocacy efforts, and to really reflect that advocacy does have that more prominent place in the revised roadmap. So we've chosen to use this opportunity to discuss the more urgent matters and how to move forward with as a collective on those. And the two issues that we'll concentrate these discussions on right now that we felt could fit into an hour were the Global Humanitarian Response Plan, or the GHRP, for COVID-19, and how we use the next roadmap for advocacy and do advocacy on the next roadmap itself. I really, really want to emphasize, before I hand over to Emily Krasner of UNFPA, who will be discussing the Global Humanitarian Response Plan, that we do not believe that these are the only things that require our joint advocacy. In fact, if you look on the forum now under the advocacy session, you'll see that there are a number of other things that we've highlighted that we think really need our attention. Questions about developing an advocacy strategy. How do we keep attention on preventing sexual exploitation and abuse, especially in the world where we're all kind of concentrating so much on COVID-19. There are questions about how we did use the previous strategy and how we could do better, or the previous roadmap, and how we could do better moving forward. So I really, really encourage you to spend time on the forum and try to pull forward what you think the call to action should concentrate our advocacy on, where we've fallen short on the past and where we feel that we can have the most impact with our collective voices. I'm going to take a quick look at the chat before I hand over to Emily. And I don't believe I see any questions specifically, but thank you to Katerina for putting the reference materials in the chat, and April for putting the links to the web TV from UN, which is the ECOSOC Haas. I encourage you to look at those either during a break or after we wrap for the day. And with no questions that I see, I will pause for a second in case anyone wants to raise a hand. But seeing no hands raised and no questions, I'm going to hand over now to Emily Krasner from UNFPA to walk us through the COVID-19 Global Humanitarian Response Plan as part of this discussion. Over to you, Emily.
Great, Lita. Thank you so much. And thanks to Joan and to Katerina for your warm welcome, and to Canada for hosting this meeting. And of course, we wish we could all be here together in person. But that said, we're going to dive into something that, you know, has a lot of nitty-gritty to it to get our juices flowing today in the first session. I'm going to attempt to share my screen. Hold on one second. Okay.
We can see your screen, Emily.
Okay, let me just do a slideshow play. Oops. Oh, excellent. Okay. So we're going to dive into a discussion about GBV in the GHRP COVID response. And then, as Katerina said, we're going to talk a little bit about the roadmap launch. So the first GHRP came out in late March. And while we did quite a bit of advocacy as the GBV community to get GBV into that document, we did not think after it came out in April, we wanted to recognize that we immediately saw a need to recognize that a standalone objective on GBV should be in the GHRP. And I know we've been over this over the last few months, but just want to review, you know, the main push, the main reasons for that push. We wanted to recognize that GBV has increased and is a primary result of the policy responses. Women and girls who are locked down with abusers. So it was these policy responses that prevented the spread of the coronavirus, or that was the intent, that put women and girls at increased risk. We want to recognize that we need to adapt and scale up services to account for this new increase in risk, and that the response to GBV needed to go well beyond the continuity of previously established services. We needed new services, we needed different services to be adapted to strategically to the new context. This came out very well in the April 5th note of the Secretary General. There's also quite a bit of evidence that services were overwhelmed, and that many services, health services and health service points, and even some shelters and safe spaces were repurposed for COVID-19 patients and were not available to women and girls. As the COVID burden was lessened, we've seen in some areas a real spike in need. So we didn't want that these GBV services to be overwhelmed as the COVID crisis lessened, where women and girls had been previously denied access during the crisis. And also measures to address the new increased risk related to COVID. We really wanted to note that they cut across all sectors and that everybody is responsible. In that first GHRP, it was really only in a few sectors, or really only in protection, that these GBV risks were mentioned. So we wanted to have more text in the narrative and also a standalone objective focusing on the GBV risks, not only in protection, but throughout a number of sectors. We wanted to really illustrate that a significant change had occurred in our understanding of the situation, even since the start around March 15th, in our understanding of the needs. And we thought that really warranted a specific objective. And I know that a number of both donors and UN agencies did try to advocate for the standalone objective, and that's why I put significant change in quotes, because some of the responses that we received noted that a significant change had not occurred, which was something that was, a little bit baffling for those who were engaging in advocacy. So we really want to illustrate that something is different, a significant change has occurred. So these are the broad strokes reasons of why we thought a standalone objective on GBV was needed in the GHRP. Okay, so as a result of this realization, a subset in the GBV AOR and also call to action members engaged in quite a bit of advocacy to have GBV as a specific a standalone objective in the second iteration, the May iteration, or I think they called the May update of the GHRP. These 5 points don't represent all of the advocacy that was conducted, but sort of these are the main pieces of advocacy to date. As I said, a subset of GBV AOR core members drafted a specific objective and came together. That was a really strong, it was a 2-hour session where we wordsmithed and, looked at the full GHRP, what was covered in health, what was covered in other areas, and how to really focus and propose a specific objective on GBV. The reason that, folks came together for this is that we really wanted to be aligned. We wanted to submit, not many suggestions for wording, but have one. So we were able to achieve consensus, and we sent the decided upon wording out to whomever asked for it, and out to everyone in the GBV AOR, and also out to donors. So we'd all be advocating for the same wording and for the same objective. Also, as Lena mentioned and Joan mentioned, the call to action statement did mention the separate objective, and it was sent to the ERC, and it was tweeted by a number of organizations, including UNFPA, Canada, Norway, Swiss, Australia, Women Deliver, IRC, and Abad. So thanks for that advocacy, everyone. So I think, it was a very, strong showing of advocacy. It was a very, we all were very aligned in reacting to how GBV was mentioned in the first iteration, and really tried to present the case in a coordinated way. Just also want to say, I think a number of agencies also advocated for inclusion of GBV in Objective 3.2. And the way that one was phrased, there was just sort of a mention of violence, and we wanted to put including gender-based violence, and that wording would have gotten it to really sort of push on risk mitigation work across sectors. And I don't think that one was taken up either. So as we all know, our advocacy was, ultimately unsuccessful. The May update did not have a specific objective, a separate objective on GBV. But yet there were, some great improvements. In contrast to version 1, the country and regional response plans in the annex better reflect the needs of women and girls. And some of them talk about an increase in GBV, an increase to calls. I think it was in Zimbabwe, an increase of calls to hotlines compared to the year before. There's a chapter in the most affected population groups, which features a box on women and girls. There's an indicator on GBV in the needs and results section. Number and proportion of GBV response services continuing or newly established to provide specialized GBV response to the COVID crisis. There are sections of specific IOs. There's short paragraphs, but 4 of the 10 in the new one mention the need to uphold and adapt GBV services. And I think another one reports on raising awareness around resources to respond to domestic violence. So, there's a number of changes that are really good. And as you can see at the bottom, the proposed wording of the specific objective that was come up by the collective. But yet there are still some issues which lead us to the question of should we continue to advocate for a specific objective in the GHRP? To start, we believe that too few country level HRPs incorporate GBV response. I think it's 57%, and thanks to IRC and the GBV AOR who helped do some of the assessment here. And in a number of them in the country annexes, GBV is only mentioned in the situation and needs sections, but not exactly in the HRP and not in the actual response section. So meaning like that's, you identify a need, but there's not an identified action to react to that need. In a number of countries, GBV services are not officially designated as essential or life-saving in COVID response. I think UNFPA's regional offices are tracking this, and I think Office of the High Commissioner is also tracking this. I know in East and Southern Africa region, I think only 10 countries have it officially designated with it as a life-saving service within their COVID plans. There's a low level of funding for the GBV sector in GHRP. There's 17, I mean, this might have changed since last week, but as of last week, the whole plan is 6.9 billion, and I think 17% of the full plan is funded. In terms of what is funded for the GBV sector, the numbers were hard to read last week because I don't think some of the commitments were showing up in the sector tally. But if somebody wants to share accurate funding on that or has it, please do share. And then there are about 4 or 5 countries that mention the heightened risk of GBV for adolescent girls, namely Colombia, South Sudan, Myanmar, and Benin. So knowing this and knowing, that there has been, some really positive changes in the GHRP, but yet we're not really seeing what we wanted to see to bring out what is needed to protect and respond to the increased risk for women and girls. Is there still a need for a specific objective on GBV in the GHRP to concentrate on protection concerns? We've already done a bit of advocacy to date. Just want to pose to the collective here, would it help to push for more GBV programming during the COVID-19 response in this way? And the next, just to give some context on the next iteration of the revised GHRP, I think it's July 16th. So. I'm going to, I can't see I'm going to exit my screen unless somebody wants me to keep this up. Hold on. Oops. Okay, great. I can see people now. So just want to kick off the discussion. Would love to hear from other people. I'm looking at the poll right now. Again, the question is there still a need for a specific objective on GBV in the GHRP? It seems that 55 have said yes, and that 5 have said no. And with this identified need, is this something that partners should really be focusing on right now in the next few weeks and advocating for? Or are there other ways to achieve this, to achieve the outcome that we want? I'll pause there.
And this is Lena again. Just want to pull attention to Nina's question, Nina Agora from Save the Children, which was, do we know why the GHRP didn't go as far as we needed it to? What rationale was given for pushing back on the specific objective? And would love to open that up to the full group.
Yep. And then also just to add to that, Lena, I know when we were discussing this in the IO working group, a lot of people sort of wanted a moment to pause collectively in this meeting and reflect on the advocacy to date, and and note sort of what was successful and what wasn't successful, and sort of learn from this for next time as well.
I'm looking to get better with silence as a general rule as we all learn how to transition to remote work. But I would love to hear maybe from others who participated in the advocacy statement drafting or putting forward the specific objective, if they heard back any pushback and how it was received, not to put anyone on the spot, but OCHA obviously does manage that process of the GHRP. So again, sorry to do this to you, April, but if there's anything that you could provide in terms of insights, that might be really helpful for us to understand where the advocacy either fell short or what the rationale was.
Am I unmute?
You are unmuted. We can hear you.
Okay, great. Thank you for putting me on the spot. Although I did have my hand up, just to share that I think from an advocacy perspective, I've in my, 8-10 years of work in the GBV humanitarian sector, have not seen as much advocacy on GBV, and I think that was really welcomed. And in all the spaces that I was in terms of with donors, we actually heard and saw many donors raising this issue. I had a lot of briefings, and so did OCHA, have had a lot of meetings with donors who constantly asked, are we going to have a strategic objective on GBV, and what would that look like? So I want to just say that, the advocacy did work, and I think our work with donors really, really helped in making sure that was on the agenda at the highest level. Whether or why that didn't translate into having a strategic objective in the GHRP, I think officially there was quite a lot of pressure and perhaps competing priorities, with other organizations or interest groups who wanted other strategic objectives. And perhaps there was a fear that if there was one on GBV, I might have to have one for, other issues. So I don't feel that there was an active resistance, and I'll reiterate again here what I've reiterated elsewhere, that while there was advocacy from donors, we could have, had maybe, I don't know, I think the advocacy could have been strengthened at that much more higher level, where, God, I know I'm being recorded, but, where we are forced to include that strategic objective. And I think because there is, there was nothing to mandate that happened, that didn't happen. And I think donors, while they advocated, they could have also been a bit more forceful. There was no conditions to, to that advocacy from donors, right? So they just said, are you including the GBV, as a priority? Is there going to be a strategic objective? But I think there could have been conditions to some of that advocacy. So that's all I can say on that point. I just want to say that, the advocacy does work. It did attract the attention of the people who were working on the, working on the strategic plan. And I don't think that there was active resistance to doing it. I mean, I think perhaps there was just not enough incentives to actually include it. But, if others have, I don't know what the official line has been to other organizations who've raised this, but certainly when I've raised it internally, there has been that, that fear that if we open it up to GBV, it might open up to, a whole variety of other strategic objectives. And there was a feeling that, it was being addressed via, under that category of vulnerable populations. That's me for now.
Thank you, April. And just for those who can't see the chat right now, it's helpful that April has posted that GBV is 8% funded currently. And that's a total of 0.5% of all COVID and non-COVID funding. So yeah, so still, you know, not, of course, what we want to be and not commensurate with the 17% overall. So just want to, you know, there's a question, and feel free to, you know, just raise your hand and, you know, pose your questions live as well. Question from Aaron Patrick here, just asking other people's thoughts sort of more broadly, and, you know, referring to the overarching goal of call to action, which is to transform the way GBV is addressed in humanitarian emergencies. The aim is to drive change and foster accountability so that every humanitarian effort from the earliest stage of crisis includes efforts to address GBV. I think this was a good example, if unsuccessful example, of the community holding each other accountable. And it's, you know, Erin says, when can we stop accepting working around the margin, and what really is not working here? So why didn't this work? Yeah, any thoughts on that, or any thoughts on, you know, going forward? Thanks, Erin, for your question.
And Erin, thanks. I think it was Liz who brought our attention to the hands up. So Erin, I'm gonna unmute you. Let me know if that worked.
Yeah, it does. Can you hear me?
Yes, we can.
Yeah, so thanks, Emily, for trying to summarize my very long rant there. But I also see Alice has just written something which was going to be my follow-up point to what April was saying about, you know, well, if we start opening up space for GBV, then we have to open up space to other vulnerable groups, etc. And I mean, I hear that, I understand it, but again, to get back to the point of call to action, it is to fundamentally transform the humanitarian system. And if we say that, you know, despite all of our efforts, despite all of our collective advocacy, and despite us within the call to action holding each other accountable, which is all great, we still didn't succeed. And that's because, well, there's also issues of, you know, persons with disabilities and, you know, persons of non-conforming sexual and gender identities and that sort of thing. Then we may as well just say, well, I guess we'll never be able to achieve that fundamental transformation, at least, you know, within the context of these sort of, you know, humanitarian response plans, etc., that we say that we want to. So, I mean, I understand, April, but I guess I don't accept it. Because that will never, you know, then that will never change, because those issues, those tensions, so to speak, will always be there. So I guess I'd like to hear us talk a little bit about, you know, are we going to accept that as a collective, or is there a way that we can still advocate to get past that and to make that fundamental transformational change that we've been talking about? Over.
Thanks, Erin. I think Elizabeth Roche, WHO, has had her hand up. Elizabeth, I think I unmuted you, so please go ahead.
I think so. Thank you, Emily. You know, I just wanted to echo a bit what April was saying, because I think those are also the two kind of concerns that are raised with me as well. First, why GBV? We aim for the objectives to be holistic. We also have school closures. We also have mental health needs. There are these kind of vast areas of need. And so if we do one objective on GBV, then we have to kind of explode the objectives. And then the second one I also hear is, you know, kind of a bit of failure, like the flip side of our own advocacy, because we speak out on advocacy so much, folks are hearing about it, and there's the sense that a lot is happening on GBV, and perhaps there's a sense and perception more is happening than is actually happening. And I think, you know, one thing I would just add is I do wonder if some of that first kind of critique, you know, it seems very common in the beginning of an outbreak response or a pandemic response to really focus on, you know, the COVID-19 transmission and mitigating risk of COVID-19 and really narrowly defining kind of the health aspects there. But I think that as this goes on, all of those issues, you know, GBV front and center, also, you know, the mental health needs and what we're doing, you know, around children's needs and all of these things kind of explode and come into the fore. And so I do wonder if we're going to be in a period now where that resistance to target specific issues that are not specifically around COVID-19 transmission, if that space will open up in the GHRP. And if we use that, you know, because I think that it's true that other issues aren't addressed as much, and they also should be addressed. I think that we need to kind of expand the way we look at outbreak response or pandemic response. And I do wonder if in the coming months there's a chance to do that, because the effects of the crisis are going to be more felt and kind of enter various spheres of our lives, from the economy to our other areas of well-being. So just wanted to add that and also say, like, maybe we can strategize a bit about how in this next phase to take advantage of some openings. Over.
Thanks. Jennifer Chase from the GBV AOR. I think you're unmuted. Please go ahead.
Jennifer, we can't hear you yet. So I'm going to try to unmute you one more time.
Does that work now?
We can hear you now, yes.
Okay, sorry. So just to say, I disagree that it was a complete failure, our advocacy. So I just want to be a bit more positive. I think that the big difference between the first and second versions of the GHRP or the updates was that there was a lot more attention paid on GBV in the second one, and I would say at the field level as well as at the global level. And I think that visibility and that attention was because of the advocacy. So just to sort of reframe that a bit, we didn't get 100% what we wanted, but I do think we had an impact. And second, just building a little bit on what Elizabeth was saying, you know, this start off as a health pandemic, and we are talking about the sort of the invisible pandemic with IPV, but now what I'm hearing is this is turning into a food and hunger crisis, and we know of the economic crisis, and I feel like protection continues to be like on the back burner and within that GBV. So I hope what you're saying, Elizabeth, is true, that there will be more space to be noticing the importance of GBV now, but I feel like already, at least in the different circles that I am in with other clusters, I'm hearing a lot now about food and hunger being sort of the next wave of attention and targeting. So I agree, we need to really, and I also wanted to just say, I disagree, the issue around, you know, we have to compete with disabilities and other vulnerabilities. I think IPV has really been receiving a lot of attention in the media. There's been statistics even on hotline usage in certain countries, and that's exceptional. That's not the norm, and that's different, I think, from the other vulnerabilities. So I do believe that GBV should be getting more attention. So I guess just a few comments. Yeah.
Thanks, Jen. Yeah, I mean, I didn't mean to, if anyone interpreted it as, you know, this was an overall failure. Yes, there was not a standalone objective, but by no means do I think, you know, the coming together was a failure. There were definitely, you know, really positive, you know, changes. Ingvild, Norway Mystery, I think you're unmuted.
Thank you. The Norwegian Mystery. I'm from the Norwegian Ministry. Sorry, I wrote it wrong.
So the name is cut off. I can't see everything.
Yes, thank you. This is really interesting. It's my first time participating in the annual meeting. And I would also like to kind of reiterate what was just said, that, you know, we have to celebrate the small victories also, because the change from the first to the second appeal was big. And from Norway's side, we are a donor and we have to balance quite a lot of things, you know, where we ask our politicians to actually step up, and they have really stepped here both publicly but also bilaterally in meetings on this issue. Also because Call to Action actually did coordinate this. We were in the kind of COVID-19, you know, we were a bit paralyzed, and you managed to kind of, thanks to the ones that initiated it, you know, you managed to mobilize us in Norway and many others, and it was improved. We have to celebrate that, not celebrate, because I mean, it's a long list a lot we have to do. So I just wanted to kind of say it's become much better, and then we have to kind of evaluate what should we kind of have more fights on pushing this within such appeals, or shall we now focus more on the operationalized plan that it's actually happening on the ground, because it's the same people doing the same stuff all over. So if we, at least on the advocacy part, shall we then focus now on having a standard objective, or shall we focus on how actually OCHA, WHO, UNFPA, others, UNICEF, our other colleagues on the ground are working? And that's where we would like to see much more focus on the what's happening in the field right now. So a lot of work to be done, but also celebrate the small victories and maybe focus on the more operationalizing of the appeal and securing that the SGBV and GBV are actually addressed for the people that actually needs to have this addressed. Thank you.
I'm so sorry. I'm going to cut in really quick because I do see that there is a little side conversation happening in the chat. So I want to make sure that we're all on the same conversation. Katarina has asked us to please set our chat to all panelists and attendees so everyone can see the comments. So if you're looking where you type your message, right above, there is a to line, and you can click on the drop-down menu there. Please make sure you have a check mark next to all panelists and attendees. And if you also look below that, you can start sending private messages to other panelists or attendees if that's helpful. But for right now, all panelists and attendees, so that we're all on the same chat. Thank you, and sorry, Emily, I will mute myself now.
Yeah, that's okay. Thanks for these comments this far. I want to put Christine Appio a little bit on the spot because she put in an interesting comment, which I'll read, and if she wants to speak up, that would be great. Christine writes, Christine is a Riga, for those who don't know. It will be difficult to fundamentally transform the way GBV is addressed in the humanitarian system without necessarily shifting the way the system works and shifting the competitive mentality that only serves to undermine the focus on GBV. So, Christine, thanks for that really articulate comment regarding, you know, the whole system and how it works, and also sort of, you know, pitting different interests, you know, against each other. And okay, if we give this one more attention, then what will we do about that one? You know, doesn't serve anyone, and I agree with that. But I don't know what the answer to that is, but I think it's a really good point. And I don't know if we're gonna, you know, how we can best sort of structure advocacy to address some of those issues. I don't know how we can change the system by July 16th, but hopefully we can find, you know, some entry points and some strategic advocacy if we agree. Christine, did you wanna talk? I think one needs to do a raise hand if they want to speak. Oh, there we go.
Hello.
Hi, please go ahead, Christine.
Hi, thanks, Emily. And to echo what others have already mentioned, it's really frustrating that the issues of GBV keeps to be undermined by simply attributing it to other issues like other vulnerabilities or even, you know, by just mentioning it. And I think it will take us a long time to fundamentally transform without necessarily shifting the mentality, that kind of mentality that that is within the system, the competitive mentality. I don't know what exactly can be done, but I'm wondering whether, considering that a number of organizations that lead the coordination mechanisms are members of the global, the Call to Action initiative, is there a way that the leadership of the humanitarian architecture can be engaged at the highest level to at least initiate a conversation on this, to kind of map out, you know, some of the barriers that comes in between, including recognizing GBV, which we know is a bigger problem in many humanitarian settings, and collectively try out to come up with some of the actions that needs to be taken to address this. Of course, it might take time. It may not happen in 1 year or 2 years, but I think that conversation needs to be initiated at some point and as soon as possible. Thank you.
Thank you, Christine. Liz?
Yeah, hi everyone. I do, you know, I think there's some discussion going on in the Q&A on this inclusion of all groups and the implications of either using language like all groups or not using language like all groups. And I think, you know, this has been a focused work stream of GBV advocates and the GBV AOR and the call to action for a long time, right? This challenging the notion that the GBV community has to include references to all groups or use terms like all survivors, right? And I think it's something that it's a narrative that we really need to change, right? It is okay, it is perfectly acceptable. And in fact, we have an obligation to retain a focus on women and girls because they are so disproportionately impacted by GBV. And, you know, our advocacy efforts have really promoted that focusing on women and girls is because that is where our focus needs to be, but it is not suggesting that we are excluding any other group or any other possible category of survivor. And I think, you know, it's really a shame that our efforts to focus on women and girls as those who are most profoundly and significantly disproportionately impacted by gender inequality, which we know is the root cause of GBV, has in fact undermined our ability to get women and girls as a focus area or to more meaningfully incorporate GBV into something like the GHRP as a priority or as an objective or however you want to frame it. And it's, you know, it's a little bit concerning to me that we do, you know, even within the call to action, we are suggesting that we use terms like all survivors or all groups instead of wanting to focus on women and girls. But I do think that is something that our advocacy efforts need to continue to reinforce, right? When we really promote focus on women and girls. And as a donor, it's something that I also have to push within my own, you know, within my own government, that we are not suggesting the exclusion of anyone else. We are simply reinforcing that this is the population that is so profoundly affected by this issue that we actually have an obligation to focus on them, but it is not that we are excluding anyone else. Over.
I agree with that, Liz. And this is something that, you know, in the intro, in the introductory material to the minimum standards, we really try to address this head on and provide people with words and content to sort of push back on, you know, the all survivor, the, you know, only you can only talk about this or that, and it's not sort of a competition. So I think that could be helpful. I want to we have, you know, not too much remaining time. And in this remaining time, I want to do two things. I want to bring attention to Kate's from DFID, to her question. In the absence of a specific objective, what else should we be pushing for in the next iteration of the GHRP, and get thoughts on that. But before we do that, if there's any working group or subcluster coordinators who are in this meeting and want to speak about this from that perspective, I welcome their voices. I see Noemi, who was recently a coordinator, has posted something. But if anybody else would like to speak from that perspective, that would be great. Christine, were you raising your hand again, or is it from before? I can't tell.
I think it's from before. Sorry.
Okay, okay. Noemi, did you want to perhaps shed some light on the country level process if you're around? I see you. Okay.
Yeah, I've tried to already wrote down that, because when you are a coordinator in a country, your issue is that you need to advocate on every single sector of the humanitarian response during the planning phase, and you need to advocate with the senior level. I was quite lucky of the managerial reaction to GBV in DRC, but it's also a country that has been GBV and in the agenda for a while. So I was invited to the humanitarian country team. I was invited to present. UNFPA Ghrp was pushing for that. The deputy humanitarian coordinator was making also UNFPA accountable, you know, asking where we are with GBV and asking to make update. The preparation to the Oslo conference was done together and all these elements. But even if there is all this attention and somehow some pressure on you as a coordinator to deliver, to be performant on planning, to find the way to have an indicator everywhere and so on, then your work reached the last phase like 20% or 15%, because the WASH cluster is only taking 10% of the activity because they have many priorities, they have cholera and so on, and then the health is the same, they take only the clinical management of rape because it's the most life-saving one, and they have other epidemics. So all this prioritization is like absorbed by the humanitarian architecture, because you don't have much power, because all your power depends on the other sector, because you are a subsector and you do my streaming too. So this is the most difficult thing for me as a coordinator to really be influenced. The call to action helped a lot in DRC, because it was like reinforcing our voice, and each cluster, each actor wasn't not traditional GBV in particular was wondering if they were doing enough. So, and the humanitarian leadership was like constantly asking where we are. So the roadmap helped a lot on that. But for me, it's also the architecture itself that is a major challenge for the coordinators to have some results at the end.
Thanks, Naomi. That's really interesting to hear. And then I know we've heard a lot about how call to action was useful in DRC.
And it was the same for the COVID plan, because they have not recruited a new coordinator yet. So I was like coaching the colleagues because I have left. And it was the same issue. They were sure to have integrated a lot. And then the final document was published at much less than the thing that they thought they were accepted by OCHA.
I'm sorry, what was that? You thought that what was accepted by OCHA? The attention to GBV within the sector?
There is, in the DRC part, there is a part on GBV.
Yes.
But the draft I saw and the question the colleague asked to have like a strong part on GBV was much more.
Okay.
So at the end, so it's like confirming what I was saying also with the GHRP work.
So only an abbreviated part was accepted into the final document?
Yeah.
Okay, understood. Anyone else want to comment on that, sort of the space at the country level to get in substance and concerns and response on GBV within the country level process? Jen writes, we know this happened in a number of countries where the subclusters provided information on GBV, but then it was not included, acknowledging that the space is very small. And these are really just 2-page GHRP summaries for COVID. But yet there's still very, limited material that went in there. And I know some of them were given a really short time to feed in as well. So. And then also acknowledging that local actors don't really have that time to feed in, so. Okay, I would want to go back to Kate's question in terms of next steps. In the absence of a specific objective, what else should we be pushing for in the next iteration of the GHRP? We'll have a few weeks to continue on editing advocacy. And I think this is a really good space to identify together what might be needed or what we want to see. If not in another specific objective, what else do we want to see in the next iteration? I see some comments on humanitarian architecture reform, but that I'm sure is a separate conversation, so. Noreen writes, we want to see progress tracked against the GBV response specific indicators. Yes, definitely. We want to see progress tracked. And we'll be doing that. And then hopefully that'll be captured well in the update section. Oswald notes, more effort should be made to make non-specialist non-GBV sectors more accountable. Agree. The development of GBV risk mitigation plans by other sectors should not be a formality. Yeah.
And sorry to jump in, but in the Q&A, there is a question from Monique Mianda. I'm sorry, Monique, my French is not strong enough to translate this. So potentially we can ask the interpreters, can the interpreters see the Q&A? And could they translate Monique's question? thank you so much to our interpreter. I hope everyone was able to switch on their interpretation. If you weren't yet, you can make sure that you're, if you hover over the interpretation button, you can go back and forth. And thank you for that point, Monique. I think you're right to look at the long-term goals of women and girls. I am sad to say that we only have 10 minutes left in the entire advocacy session. We raised a tremendous amount of points, and while I turn it over to Katarina to talk a little bit about the roadmap now, I'll be trying to summarize that as much as possible. So I'll turn it over to Katarina, who will talk quickly about the roadmap, and then we'll try to wrap up if we can.
All right, yes, so I believe we have 7 minutes before break time, so I'll just take maybe 3 minutes to ask a number of questions, and grateful if you could all brainstorm ideas and answer them, maybe put them in the chat, so this way we can read through them during the break as well. As we mentioned before, we hope to launch the roadmap publicly on the sidelines of UNGA this September, so this could be a big advocacy moment, both for the roadmap, but also we could also do advocacy with the roadmap itself. So just throwing out some questions in terms of what would we want to be the main objective of this public launch? Should it be raising the profile of the call to action, enticing new partners to join, maybe enhancing accountability? Because partners, for example, do we want to use it as a way for partners to announce their commitments and statements at the launch event, or should we try to promote accountability through other means at the same time? So, for example, publishing partner commitments on the call to action website, which will happen anyway because the roadmap does state that commitments will now be public. But we could also maybe have a social media campaign, so partners can share their commitments on social media using a special hashtag. We now have images for each outcome, each of the 6 outcomes. So what do you think, what do we want to achieve with, what kind of advocacy do we want to do around the roadmap? So please share your ideas. And as we start thinking through what do we want to achieve, how's the best way of going about achieving that? So actually have how would the launch event, what would the form be actually? So Olivia, why don't you put up that poll question? Maybe we can get a few answers, and yeah, please please write in the chat with some ideas, because yeah, it's another opportunity for us to come together. So what do you want to see? What kind of results can we have from this? Okay, so country level advocacy, Emily. Mm-hmm. Ooh, a 1 day. So Joe said, let's plan for a 1 day event. I wonder what that could look like. I don't know, Joe, if you want to speak up and explain that idea a bit further.
Yeah, sure. Thanks, Katarina. This is just coming from some of the conversations that we've had around the Oslo conference follow-up, because we are having an Oslo conference follow-up event at UNGA this year. And when we were at the ECOSOC Oslo event last year, right after Oslo, I think what a lot of us were talking about, and we had this conversation at Oslo, was rather than seeing these as milestones where we only have 90 minutes to sort of bring in all of the information, to actually look at something that's more substantive. And so that can sort of balance out the cost and the time that it takes of planning a 90-minute event, but actually get more utility and time to discuss, time to make decisions together, time to plan, that we could have in an all day. And I know, for example, that when we think about how others do this, like I know Gates usually does a 1-day or a 2-day conference around UNGA, Concordia do. And so obviously it's about balancing out that there are a lot of things going on at that time of year. But we could organize it as such that, you know, it's not asking all stakeholders to be there all day, but it's having the opportunity for us to maybe have 90-minute or 2-hour sessions with different stakeholder groups on different topics, rather than trying to get everything done in 90 minutes, which I think, in my experience, what we found is that we don't actually manage to get far beyond the sort of ceremonial aspects and announcing decisions that have already been taken. And that is useful, but I think more useful for us to utilize the time to actually come together, particularly as there's going to be this follow-up event to Oslo. Thanks.
Thank you, Jo. And just reading her original comment, she wrote, let's plan for a 1-day event rather than a panel or a round table. April also had a comment in terms of we need to refine what we want as an outcome. So do we want more funding? Yeah, so again, please feel free to share ideas and comment on exactly what do we want as an outcome, because that will help shape the event itself. Okay. All right. Look, yeah, promoting local women-led initiatives. Okay, so bringing together the launch and the follow-up to the Oslo conference. Yes, so I do realize there's going to be an event on follow-up to Oslo as well. All right, and Ingvild, do you want to, from Norway, would you like to maybe give any updates on how the Oslo follow-up event is shaping up and when that might be?
Thank you. Yes, we are the co-hosts of Oslo, which are Norway, Somalia, Iraq, United Arab Emirates, ICRC, UNIFE, and OCHA. Many of us are planning an event during the high-level week of UNGA. And we haven't gone that much further than actually knowing that we're going to do that. And we will also have, it seems like it will be, you know, that we should speak together. Of course we should speak together because we are part of the same big community and here. So yes, we are planning it, but I have to get back to you, all of you in this. Yeah. Sorry, I'm just having a meeting. Yes, of course. Sorry, we are having a meeting with the co-hosts, which I just mentioned, on July 1st, and we will have more than. So sorry, but we will have something. This was actually said during the Oslo conference last year that we would have something at the 2020 UNGA high-level week, and all the co-hosts, which we speak to regularly, want to do this. Thank you.
Great, thank you. Yeah, so feel free to continue sharing ideas, and I'm going to give it over to Lena just to wrap up this session, and we'll have our break in a moment.
Great. Thank you, Katarina, and thank you all for your work on this session. I'm really delighted by the participation. There was way more shared and more questions posed than we could have ever gotten to in an hour. But some of what I heard was that people do want the GHRP advocacy to continue, though we need to look beyond the global humanitarian response plan, both for COVID and for issues like the humanitarian architecture more broadly and how that does and doesn't assist in prioritizing GBV. Some of the questions that continue to be concerns that I've heard in previous meetings as well as this one are how we push past the strong rhetoric and how we move towards operationalization, while we also make sure that rhetoric, this high-level rhetoric, doesn't give a false sense of how much is being achieved to prevent and respond to violence against women and girls. And that we also need to continue to make the case about why GBV is especially critical to target as part of the response to COVID-19, as well as other emergencies, instead of just as kind of a consideration and a needs assessment portion. Now to the point that we couldn't get to everything. As the moderator of this session, I commit to putting some of the questions that we either didn't get into from the chats or that questions that we didn't quite fully answer or fully discuss. I commit to putting those into the forum so that we can continue discussing those as we move forward. But once more, I really implore you to spend time on the forum. We already have some other questions that were raised before this session around an advocacy strategy, keeping attention on prevention of sexual exploitation and abuse, and then this whole breadth of conversation that we had here. So please do spend time there if you can, and please add your own questions and comments and really continue the conversation that we got going. And as much as we can get to specifics, recommendations, I think that that will really assist us all in making this a really productive conversation so that we don't just spin our wheels. We are only 3 minutes over, so proud of everyone there. And I believe I'm supposed to say that in 15 minutes or at on the hour, we'll reconvene to talk about resource mobilization. And before I turn it back over to Katarina, I just want to say thank you all so much and really looking forward to spending 2.5 more days with you all.
Great. Yes, so we are going to take a 15-minute break. So for those of you in the Eastern Standard Time Zone, please come back at 10:05 and do not disconnect. You can just mute yourself, turn your video off, and then turn it back on once you're back here in 15 minutes, but no need to disconnect. So enjoy your little break. The meeting is going to resume in 2 minutes, so grateful if you could start making your way back. Feel free to bring your tea, coffee, whatever you would like. We'll start again soon. All right, welcome back, everyone. So I'm going to give it over to Joan to introduce the next session.
So welcome back, everybody. I wanted to share, did you see our colleague Yusuf from Nigeria's great comment before we broke, which was, so where's the coffee room? So I hope everybody found their coffee since there was no, Zoom coffee room. Look, now we're going to move into the session on resource mobilization. And I think we all know that ensuring the strongest possible funding for GBV remains a top priority, if not the top priority for call to action. As we note in the updating roadmap, leading donors have increased their funding for GBV since call to action was launched. And that's great, right? But we also know that the work remains significantly underfunded, as we'll hear in this session. We know there are real challenges with tracking and reporting on the money that is given so that we can then do good analysis of the situation. So I think this next panel we're having on resource mobilization is going to really help us further unpack these issues around funding, and I hope really stimulate our thinking on actions we could take or commitments that call to action partners can make under the updated roadmap to really strengthen the funding, ensure we secure the needed resources. So I'm going to ask Liz Pender, who's the Senior Humanitarian Protection and GBV Advisor at USAID's Office of Foreign Disaster Assistance, to introduce the panel and get this really critical conversation going. So over to you, Liz.
Thanks, Joan. I'll share my screen in a moment. I'm going to ask, if possible, I see Joe's gorgeous face. I'm wondering if Courtney and Mendy can, there's Courtney, hi Courtney, and there's Mendy. Okay, great. So before we start, let me just do some very brief introductions. As Joan mentioned, I am the Senior GBV and Humanitarian Protection Advisor at actually the new Bureau for Humanitarian Assistance at USAID as of last weekend. It's official. I also have been a member of the Call to Action essentially since its inception, and was part of the team at US government with PRM. In leading the call to action in the early days and creating the initial roadmap, and kudos to Canada and the rest of us for this current iteration of the next version of the roadmap. I also would like to introduce Jo Reed, who is the Senior Humanitarian Policy Advisor with CARE USA. She is also, with me, a member of the Global Steering Committee for the GBV Real-Time Accountability Partnership. And then we have Mendy Marsh, who is the co-founder and executive director of the Women and Girl-focused NGO Voice. She is also co-author of the IRC Voice, Where is the Money funding study, which we will be looking at through this presentation. And then I'd also like to introduce Courtney Cabot-Benton, who is a consultant with the Share Trust and lead researcher on the GEEWG funding study, which we will also be looking at during this presentation. We are going to really deliberately try to keep the amount of time that we speak to a minimum so that we can have enough space for discussion and questions. So we'll do our best to keep ourselves to time. Let me see if I can, the Luddite that I am, let me see if I can share my screen. Just give me 2 seconds here. Okay, can everyone see that? Oh my gosh, that feels like such a win. Why does that feel like such a win? Okay, so let me just, for the purposes of this discussion, we're going to do our best to really focus the presentation on outcome 4, which many of you know is focused on funding. We are going to, Joan already mentioned quite a bit about what we're going to discuss. We might not explicitly pull out each of the outcome areas, but they are all going to be, implicit in the presentation. If you do have questions about localization or about prioritization or about any of these, costing, tracking, advocacy, and you feel that we don't really cover them in the presentation, please do feel free to ask. Joe and I are going to hand over to the real experts in this case, Mendy and Courtney, and we will do our best to track the Q&A box. I noticed during the last presentation that there were, comments in the chat function and comments in the Q&A. If we miss something, please maybe just try the other one. It's certainly not intentional for us to overlook anything. If we also happen to miss that you've raised your hand, feel free to just insert your question in the Q&A and or the chat box. Joe, over to you for the agenda.
Great, thanks, Liz. So just briefly, as Liz mentioned, we're going to hear from Mendy. And then from Courtney. Then I'm just going to run us through some framing discussion questions to help us transition from the presentations and the information that many of us, I think, have already received in those reports, but it's helpful, I think, for us to get started with the discussion with those front of mind. And then we'll use as Liz said, the latter half of the session to really dig into these with a focus on an action-oriented discussion where we can brainstorm potential ideas and hopefully even come to points of consensus on decisions and how we can move it further within our stakeholder groups within the call to action and through the other structures that we work through. So to get things started, we have a quick poll, and nope, it says, what should we do for the roadmap launch? So imagine that the poll is asking you the question, how do you feel about any changes to the levels of GBV funding over the past year in 2019? Do you feel that they seem to have significantly increased? Do you think perhaps they've increased a little bit, or haven't actually seen any real change, any meaningful change? And so you might want to think about what you're hearing from others in your stakeholder working group, what you've seen. And here we are. Thank you so much. We've got the poll up now. So please vote. And this is then going to transition us into hearing from Mendy about what did happen. And very interestingly, I think that there is the majority of people, it looks like about 85% of people are somewhere between no meaningful change and maybe a slight change. But it looks like, despite the fact that some donors did significantly increase their GBV funding during that time, the overall picture, as far as we're aware of it, is that there hasn't been a significant change. There might have been a slight positive change, but actually the majority, almost 50%, think that there was no meaningful change. So over to you, Mendy, to help us unpack the data.
Great, thanks, Joe. It's wonderful to be here with everyone. I don't think I can move the slides.
Yeah, I'm trying to move them, but it seems with the poll open, I can't. Let me see. There we go.
Okay, great. So it's a pleasure to give you an overview of the study that we did with IRC. Where is the money? How the humanitarian system is failing to end violence against women and girls, or gender-based violence. So I'm just going to give you some really high-level overview points from our findings from the report. So we know that violence against women and girls remains severely underfunded. During the period, it's very hard to get at the numbers though, for a range of different reasons, some of which I'll go over. Between the period of 2016 to 2018, only around 51 million was explicitly going to the issue of violence against women and girls or gender-based violence. And that only accounts for 0.12% of the overall 41 billion that went to the overall humanitarian aid system during that time. So we really have a long way to go. And this is despite really high-level global commitments to increase funding. The progress just really isn't where it needs to be yet. And I think that really came out in the poll. Can you click on the next one? So one of the big reasons that came out for this is there's a lack of expertise that really keeps the prioritization from happening. I always like to go back to one of the quotes from one of the donors during the key informant interviews. They said, you know, we had money available, we were ready to fund, but there was no one there. There was no one asking for the money. Or when we had meetings with senior management, they were raising all kinds of other sectoral issues. They were not raising the issue of needing to address gender-based violence. You can go to the next one, Liz. And so it's really hard to find consistent, reliable information. There's a lack of disaggregation on the requirements. The asks for what is needed are really way too low given the magnitude of the problem. There's all kinds of issues with disaggregating and coding. Everyone's coding differently if they're even coding. There's challenges with tracking unearmarked money versus earmarked. A lot of the donors are better at tracking their earmarked funds, but there still are issues even around that. You can go on to the next one. So we just wanted to deep dive a little bit into Yemen. So the overall amount requested through the HRP was 2.96 billion. The amount requested per HRP for gender-based violence was 24 million. And the amount requested per the financial tracking system, or the FTS, was 3.11 billion. The amount received per the financial tracking system was 2.65 billion. And then the amount allocated to addressing gender-based violence was 3.32 million. The amount received for GBV was 3.32 million. And the amount committed to addressing violence against women and girls, or GBV only, was 0. So there's issues with the financial tracking system as well. But overall, we're really just not seeing what we believe is the decent amount of ask, or the level of asking for needing the needs. We know that gender-based violence in Yemen is a severe problem. So we really want to see in the future bigger asks, but we also need all agencies to be updating their information in the FTS so that we have a financial tracking system that is closer to the reality of where money is going or not, what's really being allocated to addressing gender-based violence. You can go to the next one, Liz. So there's this, I love this slide. I think that it really kind of tells a good story. It's not a good story, but it tells the story. So the vicious cycle of funding, because we're not having the right ask, we don't have the right people on the ground, the violence that we're talking about is rendered invisible. We have small scale programs that still remain largely invisible. We have limited opportunities for learning, so we aren't building the evidence base the way that we could. We're not building the GBV related expertise the way that we need to. We have a lack of capacity across all sectors, including for specialized programming, but across all the risk mitigation sectors of all the 13 sectors of humanitarian action. And then we have this scenario, this recycle, where GBV programming is likely less funded due to the lack of expertise. So if we really think about this cycle, we can start thinking about what are some of the key things that we need to be doing. You can go to the next one, Liz. So I just want to go into some of the specific challenges that we uncovered. So in addition to not having the appropriate sort of needs analyses and the amount of money required to meet those needs, we can't look at just pooled funds. That only tells us one small portion of the picture. So there's not really one thing that we need to be looking at. We need to be looking at a whole range of things. The investments made to prevent GBV in emergencies across sectors are often not tracked. There's a gray area around investments related to gender-based violence and then gender equality that makes it really hard to figure out how much is really going to the issue of gender-based violence. We have the significant human resource needs that I mentioned. We need all agencies to really, whether they're donors, whether they're specialist agencies or non-specialist agencies, we need everyone to increase their capacity to have expertise in-house to meet the needs of, and to do accurate funding, but also programming. And if your agency doesn't have that system or those experts in-house, you need to figure out how to get those experts just to support you. We need to fund women-led organizations. We need to make sure that our systems or our accountability systems are adapted so that we can get more capital into the hands of women-led organizations. We want to make sure that we are not instrumentalizing them or tokenizing them. We want to make sure that they are actually able to program the way that they need to program, but they have the resources to do that. Lots of donors mentioned that there's just no way we could ever fund small women-led organizations because they just wouldn't be able to handle our tracking or accountability systems. It's just not the way that we fund. We have to give bigger checks to bigger organizations. So a range of things came in, but we really need to reflect on how we can truly support the localization agenda. We know that virtually still very little money is going to civil society organizations, but especially ones that are led by women. And then accountability. So we need to facilitate or come up with guidance so that we actually have systems to help organizations code. We need to have some sort of common dialogue and framework for how we track and introduce accountability systems. I think the call to action could really play a strong role in developing these systems. We need to make sure that the programming, as this has been mentioned, but we need to make sure that there's flexible long-term money going to address the issue of gender-based violence. We're often seeing that we have programs that are starting and then we're bringing in expertise and then those programs are stopped. And there's lack of sort of reporting on those outcomes often, and donors really not knowing how that money is being used. And this really needs to change. We really need to strengthen the accountability around reporting on the call to actions, especially amongst donors. I think we've come a long way with the call to action, but there still is a lot of space to grow in terms of really figuring out how we're having transparent conversations around investments. Is it really new money that's coming in? Is it really a greater investment, or is it just repurposing of existing money? Can we get donors to request that when they are giving unearmarked money, that they are asking those agencies to report on how they're making decisions on how those unearmarked funds are being used, right? We have a lot of organizations, but in particular the UN system, that gets tons of unearmarked funds, right? But we're not necessarily asking those entities to report on how they're making decisions around how they prioritize where that money has gone. And we really need to make sure that we are increasing human resource capacity to do the relevant tracking as well. I think that was a huge gap that came up, that even if an entity had a better system for tracking its unearmarked and earmarked funding. They may not have people on the ground to help with coding, whether it's in a UN agency or in an NGO. They may not have people that know the issue well enough to track things appropriately. And then that causes all kinds of issues around really being able to track and follow the money. I think the decentralization of a lot of organizations, a lot of donors also makes it very challenging to do the appropriate tracking and coding. And so we really need to think about that in any kind of guidance or support that we pull together to help improve on this accountability. But ultimately, if we don't fix this issue, we're really never going to know and be able to track that we're making a significant difference in terms of increased amounts of money to the issue of gender-based violence and emergencies. Liz, over to you.
Thanks, Mendy. So before I hand over to Courtney, who is going to go into a little bit more detail on findings from the study that she led, just a few summary points. It's clear that there are these disparities on how we report and how we track funding. You know, I mean, looking at the snapshot that Mendy provided on Yemen, the findings of that that are pulled from financial tracking systems, for example, do not reflect the significant amount of money that US government, for example, has put towards GBV in Yemen, which is not to suggest that we've directed enough, but I'm just noting that what we did channel towards standalone GBV programming in Yemen is not reflected in that. And that just goes to show that we need to find, we might need to find more than one solution, right? It might be that there just isn't one single solution, that there can't just be one single tracking, one single reporting mechanism. I do want to, you know, I think this point of earmark funding not being the solution is an important one. And something else that Mendy mentioned that I think we need to remind ourselves is that I think we often default to, when we think of donors, when we think of funding, we're thinking of that state level donor. And as Mendy said, you know, donors are, yes, they are states, they are also UN agencies, and they're also international NGOs. And I think particularly the UN agencies and the INGOs play that critical entry point to hold ourselves accountable to women-led organizations as the donor community. And the donor community is much broader than we really tend to think it is. So with that in mind, I just wanted to pull out some of those key themes, you know, in this point on complexities, right? It is evidently a really complex, multidimensional, varied issue. With that in mind, just summarizing some of the points from Mendy. Courtney, I'm going to go ahead and hand over to you. Just let me know when you're ready to, when you want me to flip the slides.
Perfect. Thank you so much. Much of what I will present kind of builds on and echoes what Mendy was just presenting. So we were asked by UN Women and UNFPA to look at funding for women and girls in humanitarian contexts globally, and specifically wanting to track how much funding is requested, how much funding is received, what is the gap, and what's the implication of that gap. So I'll just highlight that this is not a GBV specific study. It was all funding for women and girls in humanitarian crises, but obviously GBV was a very strong component of what we're looking at, and much of the findings are echoed across what Mendy was just presenting. Just to say as well that we relied heavily on the FTS and the gender marker because we did quite a broad review of the different funding tracking mechanisms, the different markers, and it was really, really hard. I mean, everybody's using different systems, different criteria. It was very hard to get something that was consistent, and the FTS did provide the largest source of one pot of funding that we could evaluate. So we did a really deep dive on that. But to Liz's point, that obviously doesn't capture all of the different flows in the system, but we couldn't evaluate all the different flows because they were all using different systems. So if we can go to the next slide, I'm going to present the findings rapid fire and happy to answer questions afterwards. But just to give you a sense, we did a deep dive on 3 countries, Bangladesh, Nigeria, and Somalia. And we basically went into all of the FTS data for the humanitarian response plans for both 2017 and 2019 for those 3 countries, and evaluated and reclassified all of the programs for whether they were tailored support towards women and girls, i.e. kind of mainstreamed, and equally whether they had targeted support. And this was typically where a lot of GBV and SRH funding sat, though not always. The first slide here is showing you what the results of that reclassification were. So the bar on the left, the blue bar for Bangladesh, is showing you how people were reporting their funding against the gender marker. And the bar on the right is showing you how we reclassified those. So we found that 25 to 30% of all funding flows reported to the FTS for these 3 countries were misclassifying and overstating whether their program was targeting or tailoring towards women and girls. So that's one big piece of the puzzle that we're trying to address. How can we make that gender marker work more efficiently to actually allow us to track more effectively? Next slide. We then, as I said, looked at the amount of funding requested and the amount of funding received. The amount of funding requested, the bottom 2 bars are the amount of funding that is tailored and targeted, so the dark blue and the medium blue for Bangladesh. And the lighter bar is all other funding, i.e. all the rest of the programming that didn't give any indication that they were either targeting or tailoring to women and girls. And as you can see, funding for women and girls is falling significantly short of the overall request. There really were very few categories of programming in any HRP that you could justify should not be identifying the specific needs of women and girls and addressing those. On the positive side, which is interesting given the poll question, you can see that in all 3 countries, we saw quite significant steps up in the amount of funding that was targeted or tailored, particularly in Nigeria and Somalia, where things had really experienced quite a big uplift. Next slide. Then the next thing that we looked at was coverage. So we wanted to look at, as we know, humanitarian response plan goes in, it's never fully funded. So what is the coverage on average for humanitarian response plans? And for our 3 countries, that was 69%, that's the bar on the left. And then we looked at how much funding was received against the amount requested for programs tailored to women and girls. As I said, these are more mainstreamed activities, and then targeted towards women and girls. And I think this is really important, again, going back to the fact that a lot of the GBV funding was captured in the targeted category. We found that coverage for targeted programming was 39% as compared with 69% for the overall humanitarian response plan. So you can really see here that not only are we not requesting enough, but even when we do request, the amount that's getting funded is disproportionately lower compared to other types of programming. Next slide. And so kind of one of the main conclusions out of this study was that this combined effect signifies a double threat for programming for women and girls. So again, just taking the bar on the left, Bangladesh, the blue bar is showing you the total amount that was requested for the entire humanitarian response plan. The red bar shows you the amount that was requested for women and girls. And the green bar shows you how much was received. So you can see how much is getting shaved off as we go through the different stages of the funding process. Do I have a next slide, or was it those? I think it was those. Okay, so just to say a couple other points very briefly that really reinforce some of the other topics that are coming up. We did try to look at funding for women-focused organizations, and that was basically impossible to track, and we found little to no evidence in the project documents as we were going through them. So we really, that was another key finding out of the study, that was a very significant gap and something that needs to be urgently addressed. And the last point that I just want to raise is that we also found a real lack of gender transformative programming. And one of the pieces that we found really fascinating was that in our country field visits, it was very evident that the lack of funding for gender transformative programming, social norms, behavior change, which is typically viewed as the kind of thing that quickly gets cut in a humanitarian crisis was actually directly undermining the ability of the humanitarian response to deliver access to basic services. So by not addressing violence, we were seeing very direct impacts on, and this will be familiar to all of you, but on women's access to water and sanitation, to health facilities. So it actually was deeply embedded in the humanitarian mandate to be addressing those issues, and yet was one of the first things to be cut. So I will leave it there so that we have time for questions, and happy to dig in more. There's obviously much more behind that.
Thank you, Courtney. And I think before I hand over to Joe to go over the discussion questions, it's so evident, you know, it's clear that your findings reflect previous research. And I also, I'm just going to take facilitator license here and suggest that maybe we need to revisit the conversations we had years ago about maybe having a GBV marker and not just a gender age marker for a lot of reasons that you already mentioned. Joe, over to you on the discussion questions.
Great, thanks very much, Liz, and thanks both Mendy and Courtney for your presentation. So Olivia, I think we have the second poll ready to go now, which will take us into the discussion questions. So just to warm us up in the discussion, we've got nearly half an hour, and I hope we can use all of that time to have a really rich discussion and hopefully move forward with putting different proposals on the table. So you'll see in this poll, we've taken the 3 most commonly referenced sources of information from GBV funding, although as we've already talked about, none of those are perfect. None of those are used unilaterally by all stakeholders. So if you could vote on this, I think it will help us get started up with our conversation about tracking and how we track and report on GBV funding. And there's also been a great discussion already in the chat, which we will weave into the discussion. And just because you've already put it in the chat, please do feel free to put your hand up so that we can bring this in and have a holistic discussion over the next half an hour. So we see that the top priority source of information for GBV funding with 59% is the FTS, which is very interesting, given that we know that some donors, and maybe Liz, you can speak to this later on, we know that not all donors report directly to FTS. We see then that the runner-up was the call to action progress reports, and we know that, well, correct me, Katerina, if I'm wrong, but I think that it was voluntary reporting from donors this year on the amount of GBV funding that they put in. So again, we have some people able to report information there and some not. And then we also have at the moment a follow-up from the Oslo conference where there were significant pledges made. And there is a consultant from Humanitarian Outcomes working on trying to follow up to that. So of course, this isn't an exhaustive list, but useful, I think, to get us started to look at some of the different areas that we're looking to for GBV funding, some of which overlap. So I'm going to stop the poll, stop share, go away. Okay, Liz, could you share the screen with the PowerPoint again, please?
Oh, sorry, I thought you had already gone over those. We had a little bit of a dog freak out here, so I put myself on mute and couldn't hear about 80% of what you said, Joe.
Sorry.
One second.
Great. So the discussion questions, and again, this isn't to limit our discussion, but to maybe get us started. look forward to hearing your responses not only to these questions, but the other questions that these raise. So one of our questions is about the policies and the systems that we have in place domestically, perhaps to create an enabling environment for accessing and tracking GBV funding. So we know that some donors, for example, they have domestic obligations to report on the amount of funding going into GBV and emergencies. But that isn't the case for all donors. So it would be very interesting if during this discussion we can hear from some of the donors who maybe are trying to address this challenge of tracking how much funding is going to GBV and emergencies in order for them to be able to respond to the voluntary reporting for call to action or from Oslo or FTS. But maybe there are obstacles in place that we could work on trying to use some of the good practice of these enabling policies that are in place. For example, for the USG, perhaps they could be useful elsewhere. Our second question is around useful and impactful funding models. So we've already had the start of a conversation about earmarking in the chat. And I think that this was a very live issue last year when we were at Oslo, and we had a particular target, and we were asking donors to make pledges for GBV and emergencies. But alongside that, we've been having a lot of conversations through the Grand Bargain about moving away from earmarking. And we have seen some really interesting evidence from donors that have switched to a needs-based model of funding GBV. We've seen a real exponential increase in the amount of funding going into GBV and emergencies versus when an earmark is set. Another question that we have is about the purpose of GBV funding, tracking and reporting, to really try to unpack why do we need this information? Because I think that there are a lot of requests for that information, but we want to see how we can use it in a tangible way beyond being able to make the anecdotal observations that we currently make. We do need more detail in order to make progress to scale up and as well as to coordinate when we think about call to action field implementation across the partnership and where that money's going and how we'll prioritize it. And then finally, we've asked a question on commitments that could be made by donors, IOs, and NGOs to realize the call to action funding outcome. We've seen a few ideas already raised on how we can really transition to a field implementation and a field focus. And I think it's a really interesting question for us to ask about funding. And given that the majority of donors allocate funding at a country level rather than a global level, and many of us are sitting at the global level, I think that's a really useful area for us to interrogate together. So a number of points have been raised in the chat, and I also see that Richard has his hand up.
Sorry, Joe, I'm just going to stop you there really fast. I'm just going to let folks know that I'm going to, and Joe, it's just a brief interruption. I'm just going to let folks know that I'm going to stop sharing my screen and remove the discussion questions so that we can better track the Q&A and the chat. So I'm just going to keep these in mind, but we also welcome any other questions that people want to raise. So I'm going to go ahead and stop sharing, and then Joe, back over to you. You were already starting to dive into some of the comments and questions.
Great, thanks, Liz. I'm also putting these questions one at a time into the chat now. Richard, you had your hand up. Over to you, sir. Are you able to speak now?
Yes, I think now I'm unmute, so I can speak.
Great.
Yeah, that was a very great presentation. Thank you so much. And thank you to all the other people who are here today. This is a very important conversation, and I would like to just point out some few comments in regard to some of the questions that you have posted. I am talking on point or things that are related to South Sudan, so I may not be aware of what's happening in other country, but specifically on my experience in South Sudan, I know that it is, maybe I may be wrong, but if you look at the GBB specific programming, where you receive a call for proposal from donors, those kind of calls are quite rare. You would always find a call that is integrated, where you'll have maybe, as I have seen in the chat from other colleagues saying that they will say it is a food security and livelihood project, but with some integration of GBB or protection, which I think do not bring out the real GBB issues. And that means the funding sometimes do not go directly because they will just say mainstreaming. I think that is one issue that maybe is something that we need to look at how we can try to have a standalone GBB project that are dedicated to GBB project. The other thing that I also would like to mention is about the restrictions or the issues that hinders most national organizations or local NGOs or women-led, mostly in a country, for example, in South Sudan. You will not be eligible for a call for proposal that has been put up maybe by USAID or by any other big donors, as with a consortium of local-led, women-led organization or national organization. You will have to go with maybe with somebody, maybe with an INGOs. And we'll find that INGOs, either because they have their own way of running their programs, or they have no communication or authorization from the headquarters, they will not be willing to go with a national NGO. So they will go on their own. And I have seen in this call for action where there's a push for localization or for making sure that national organization or civil society organization are taking lead. I would suggest that most donors should actually make it, if possible, mandatory that the localization clause, that international NGOs that are applying for funding, whether they are specifically for GBB or protection or other related funding with GBB component, should actually be able to make it perhaps compulsory and say you have to come with a national organization, women-led organization in your application for us to fund you. Because if you don't give them that, then they will always look for an easy way and say, I think we don't have capacity to work with this national organization, and therefore we do not want it to commit ourselves. I think those would be my point that I wanted to share with you. Thank you.
Thank you, Richard. I think that's, I feel like you made some suggestions that, and I hope that everybody was able to hear them because you were coming in and out a little bit, but I heard quite a bit in your comments that could translate into actual commitments that people can make to this particular outcome. And that, those commitments can come from donor states. They can come from INGOs. They can come from UN agencies and IOs to hold us collectively more accountable to women-led organizations and the like. I'm noticing, and maybe I'm missing something, but it feels like most people are posting their questions in the chat box and not in the Q&A box. So if we're missing anything, let me know. But I just did want to, Elizabeth Rush asked for a clarification on what we meant by earmarking. I think, correct me if I'm wrong, I'll defer to the others on the panel, but I think we're suggesting that earmarking funding solely is not the answer, and that it can sometimes hinder GBV funding. And if, for example, you look at USG, I think the point we were trying to make was that the funding that is earmarked for GBV is actually substantively less than the funding that we direct towards GBV based on, responding to demand, need-based. And then I also want to encourage folks to see the suggestion that Christine Appio made about creating a commitment or considering a commitment to this particular outcome around Christine, I'm not sure. I feel like I've lost your comment in the, oh, here it is. For the updated roadmap, would it be feasible for donors to commit to set up some sort of pooled funding that can be accessed by women's organizations, which I think is an incredibly interesting and incredibly interesting suggestion. I see a few hands are up.
Yep, we have Noemi next, and then we'll be going to Angelina, Yusuf, and Ingvild. So Noemi, I'm going to share the screen with the tracking document that you mentioned in the chat, but perhaps you could introduce it for those who didn't see you on the chat.
Okay, so with the roadmap in DRC, the donors, after the midterm review, they decided to have a follow-up meeting on allocation or all decision of funding to do an analysis of how much money they have put in GBV during the last year. It was quite complementary with the impact evaluation, because the same 2018 was covered by the impact evaluation that was just published in DRC, but not 2019. So there was already some elements that was the basis. So that's the document that has been developed by ECHO and Canada. They were the two states pushing and convening the other. And all these countries and the World Bank and OCHA completed with the different amount. And we decided to put difference between, we tried to analyze which kind of funding were development, nexus, or humanitarian. And we also included which is in the HRP or not, which is more on the right, because, for example, ICRC is not counted in the HRPs in the funding part, but for us it was interesting to have an idea for all fundings, also the one who are not really planned in the HRP. So we saw. So that's all the states, and we also put all the implementing partners. So in this way, we could have done an analysis on which local organization took funds, which UN, etc. And on the right, well, some of them were each donor decided how many money to put. Some donors explained that they have a method, at least 15% is going to that was focused on GBV, that was not. So each donor, according to his methodology, they put in the column the money. And when we look at the comparison between 2018 and 2019, if you go down, 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 we can just show the hand. We can see that there was, well, quite an increase, but the gap was the increase was most the humanitarian part, because many development funds weren't yet approved. For example, the big World Bank was about to come, so it was announced. So this was a way the donors have put together to complement the fact that the FTS wasn't really full of information to make an analysis. So they decided to do that. That's all for me.
Thank you so much, Noemi. That's really helpful, and I think further reinforces what we heard from Mendy and Courtney. I put in the chat box just a time check that we only have 15 minutes, and there are clearly a lot of questions. So for those of you who have questions or comments, just if you could try to keep them concise so that we can fit as many more speakers in as possible in a short period of time. Joe, who was next? You're muted, Joe.
I don't see Angelina's hand anymore. Maybe she's dropped off. So the next was Yusuf. So Yusuf, go ahead.
Thank you very much, Joe, and thank you, Liz. I just want to thank my good friend Richard for the comments he has made. He has made some of the comments I want to make. And in Nigeria, there are calls for proposals that are strictly on GBV. For example, we are implementing the Spotlight Initiative on eliminating all forms of violence against GBV in Adamawa State, and UNFPA is spearheading that. But I'd just like to also recall that last year in Geneva, there was a high-level event on the side of the annual meeting. And one of the comments I made, I was privileged to make a presentation, is that I like to encourage us to see local NGOs as your boots on the ground. A situation where we keep complaining about lack of expertise, lack of capacity, and so on and so forth. It's just like having your soldiers on the ground that are ill-trained, ill-equipped, ill-funded. There's nothing they can do. There's no how they can deliver. And we cannot have significant outcome of our fight against GBV except there are changes on the ground. And so I would like to encourage that we practicalize the localization that we have been talking about. I keep hearing international and national, global and national, global and national. We need to go regional and local because perpetration of GBV is on the ground. Therefore, the fight must be matched on the ground. We have soldiers on the ground. Let us equip them, let us train them, let us fund them. We will see a positive change. Thank you.
Thank you, Yusuf. Joe, I don't know if you saw, yes, there's Angelina. Angelina, you can, if you unmute yourself, go ahead with your question.
Well, thanks to my colleagues that have already spoken ahead of me. My addition are just few. I think we still have issues as the local partners in terms of coordinations. And I precisely mentioned this on the side of women-led and women rights organizations. For example, the HCT and CHF, which is a Common Humanitarian Fund Advisory Board, where most of the key decisions are being made. We don't have female representatives that are really sitting there. In most cases, the decisions that are being made do not favor the women-led organization, and that affects us when the finalization are done later, we are left out. The other thing that I also wanted to raise up, we have challenges to do with short-term funding. I think GBV is not a short-term project, it's a long-term thing, so we need to look at it. How could, at the global level, advocate for multi-year funding to address the GBV issues. The other third thing that I wanted to add on is we want to look at it, how do we also bring in the equal partnership? Because we've been talking about localization agenda. We also need to look at it, it's not one person receiving the other side, but then we want to sit down and see, is that a transparent partnership with the local, that local have rights and decision on the same table? This has been a gap mostly in South Sudan, and I think we need to look at it, and also not treating GBV as a sub-component, because I remember most partners will always look at it like it's a sub-component, so they'll prioritize food security, health, and other sectors. For me, GBV is a serious crisis in South Sudan that needs to be tackled properly. Thank you.
Thank you so much, Angelina. Those are all really important points, and I think we all can agree that GBV warrants its own standalone focused support, and there is tremendous need for both GBV risk mitigation, but also standalone GBV programming, that the two, one is not a substitute for the other, that if you just incorporate GBV risk mitigation into another sector, it's just good programming, right? It's just safe programming, it's just good program design, but it doesn't necessarily mean that you are implementing a strong holistic GBV program. Joe, over to who's next?
Ingvild?
Yes, thank you. And I will be short then and try to. I have so much sympathy for you, and I really, the best thing would be for us to give all our funds to the local actors. But it's not just possible because it's not all our funds, but a lot of it, because just due to kind of bureaucratic, sitting in Oslo, working with the whole world. But I just want. Important thing to have in mind is that earmarking is a trend that's going out. I think most donors at least of the medium big size like ourselves, are going away from earmarking. So we have to find other mechanisms on how to track and how to demand accountability for. Can you hear me?
Yes, we can hear you.
Oh yeah. So we will also, with our INGOs partner, Norwegian NGOs partners also, we are also going away from earmarking. At the same time, we want to raise, certain issues. Like Norway is a big advocate for SGBV, and this is really high on our agenda. So I wish I had the solutions, but I just think having another gender marker within the DAC regulation. It's good. In theory, it's good, but in practice, we will have the same. But a lot of things: secondary education, indigenous population, people with disabilities. It's so much earmarking that we, as bureaucrats, or also desk officers in NGOs, wherever in the world, regional, local, it's just demanding so much work from us. I mean, I think all of us feel that the tracking and the markers and the So I just want to say that we have to be a bit. I don't have a solution here, but I think there is something in doing the backtracking and holding our organizations and ourselves accountable for what we did in 2019, and then we must not kill ourselves or load ourselves with so much reporting, which we in Norway also are doing now with the tracking of the Oslo conference. And we hope, and we will work for now to try to kind of merge the CTA and the Oslo tracking also, just for you to know that. So my point is that there will not be more earmarking. Thanks.
Yeah, thank you so much. I think, this issue of earmarking, as you can see from both Courtney and Mendy's presentations, is a complex one. And it's obviously also linked to the question of how we can hold ourselves accountable to women-led organizations and women-focused organizations who, as I believe it was Yusuf said, are our boots on the ground, right? They are our warriors in the field. And I think when we talk about earmarking, that we, again, just to reinforce that we're not in that circumstance, we're not only talking about donor states. We're in that particular case, we're really talking about UN agencies and IOs and INGOs who, many donor states direct our money to those entities with the expectation that that money will then trickle down to local partners and to women-led organizations. And if we were to take a different approach than earmarking, we might be able collectively to hold ourselves more accountable to women-led organizations and ensure that much more funding is getting to those people that are truly doing the work. Courtney, I believe from the comments box, you had a comment?
Just a very quick closing comment to say that this was actually a key point that we explored in this study, and we did extensive consultation, hundreds and hundreds of interviews, both at global, national, regional, and local level, and in particular in Nigeria, Somalia, and Bangladesh. And we specifically asked people, how do you think this can work? Because we really picked up on this very significant tension between sort of good practices around flexibility, on earmarking, multi-year funding. We know that those are absolutely critical for good programming to allow local actors to do what they need to do. And yet tracking funding often feels very much directly in competition with that. And so we asked people quite extensively about this, and the feedback was consistently that people felt that their programming was much more effective when they could roll it in with other types of programming. And that was for a variety of reasons. It was partly because if they wanted to target SRH, it was much easier to do that if it was part of a health program, because that was the only way in many contexts that they could get women to the clinic to then target with them with services. It was because it was easier to get it through donors because it was part of a wider project. Whereas if it was a targeted GBV program, it was harder to get funding for it. I mean, there were a whole variety of reasons that were driving that, but they really felt that in order to be effective in programming, they needed to be able to mainstream and integrate. And I think that is a really tough question, and it's a really important one, because if we track funding, which we know we need to be accountable, we may risk also undermining our ability to do quality programming. And I just think that's a really important point, but I wanted to feed back because we had asked so many people their opinions. That was very much where most people had landed.
I mean, I think you're absolutely right, Courtney. And again, it just goes to show the complexities of this issue, the dimensions, the multiple dimensions of it, the range of variables and the range of considerations. For those of you who are not aware, the Real-Time Accountability Partnership Global Steering Committee has actually created a task team looking at funding models and trying and recognizing that as I believe Mendy mentioned in her presentation, because there is no single solution, wanting to reflect and deliberate on different funding models, different considerations, earmarked, not earmarked, reporting, not reporting, integrated versus standalone, funding that is more accessible at the field, funding that is more accessible at the global level, and how and where decisions are made. So, we'll be happy to update the call to action and to actually request input on this. With that in mind, we are at the end of the session, I believe, maybe with 30 seconds to spare. So I'd like to thank all of you for your participation and engagement and really, really thoughtful comments and inputs, and a particular thanks to Courtney and Mendy for presenting and for sharing findings and for actually leading some of this really critical research. So Joan and Kat, over to you.
Thank you so much, Liz. Thanks to everybody. We are winding up our first day. Just a couple of things. Just a call to attention on your agenda that there is a side event that begins at noon, and our colleagues at Action Against Hunger are doing a side event on COVID-19 and beyond, a feminist approach to gender, food security, and economic crisis. And so we hope that as many of you as possible can reconnect at 1 to hear that presentation from Action Against Hunger. Thanks to everybody for the engagement, for the questions, for the comments. Just to say too that to reiterate that the PowerPoints that were used today will all be shared after the meeting with everybody too, right? So everybody will have access to that. And of course there'll be a meeting report. Tomorrow, you will notice on your agenda that we're entirely focused on field implementation. How can we really strengthen engagement and implementation of call to action at field level? So in preparation for that, if you have time today to take a look at the accountability framework, which was shared in the email from Katerina with the resources for tomorrow's discussion, and also the draft field strategy that was shared in that same email. If you have time to take a look at those before the conversation tomorrow, all the better. But with that, I think we will wish everybody a good day or a good evening, and or middle of the night in Australia's case, possibly at this point. And thank you all again, really so appreciated, and see you all tomorrow. Thanks a lot. Bye, everyone.
And see you all in an hour, hopefully, as well.
Oh, yes, sorry. Don't forget the side event. Exactly. Bye.
Thank you all. Bye.
Bye. Naima.
Hello, John.
How you doing?
Yeah, fine, thank you.
Good. Thank you for your pretty painting there on the wall.
Oh, yes.
We appreciate it. It's lovely.
It's fall.
Yes. Naima, do you want me to introduce you? Or are you just going to leap in? Which would you like?
Yeah, that could be nice.
You would like me to introduce you?
Yeah.
Okay. Shall we start? Or
I think so. My colleague Aminata is there.
I think I saw Aminata, yeah.
She is joining with us from Senegal.
Can everybody hear us yet or not yet? Katerina, can the group hear us? Oh, I see many people can hear us. Thank you, people in the chat. So hi, everybody. Welcome back to the side event. It's great to see such a good group for this. And we're super excited to have this presentation from Action Against Hunger. I think we have multiple colleagues that are going to be part of this, it sounds like, but I believe our colleague Naima Chaudhry will help organize the session and kick us off. But just to say, it's hard to think of something more urgent right now than this issue of a feminist approach to gender, food, and economic crisis in this time of COVID-19. So I think we're all looking forward to learning a great deal, to getting some insights that can help us all in our own work, and really appreciate you all giving your time to this side event. So thank you very, very much. And with that, Naima, I will hand it over to you.
Thank you very much, Joan, and welcome all for this session. And we are presenting from Action Against Hunger, myself, Naima Chaudhry, and my colleague Aminata Ba. We will talk about a little bit on the situation that we are facing and what we can do so far, what we can think so far, that how we can help with regards to food security, to confirm the food security and economic inclusion for people, particularly women, and people who are in marginalized context and socially, culturally, physically marginalized people, and how the entire economy can help them. So let me start with the presentation. So can you, how to share that? I'm facing some difficulty with regard to sharing my screen. I don't know. May I get some help from Olivia and Katrina? Okay, share screen. So share. Can you see my screen?
Yes.
Okay, I'm sorry for taking this long time. So as Joan said, it's more like the feminist approach that we are trying to bring in the discussion. So what we see when this situation started, basically it started suddenly with surprise, shock, fear, and everywhere that what is happening, no clues like that. So many positive initiatives were taken by many of the governments, the country governments, regarding implementing lockdowns, so to stop the spreading. Humanitarian organizations that we have seen came together in response to food support, relief, etc. A good reflection by the community people as well. So many of the community people in different countries, they took the responsibility to help others. Most importantly, what we have seen that women's rights organizations in many of the countries were involved in the discussion with government from the beginning, particularly to suggest to ensure food security for women and children. So we have seen that from March, there's many statements came from the organizations, webinar to help to understand and also to include gender equality in the discussion. So the first and foremost sectors that we have seen that got attention is food security and nutrition, health, physical and mental health situation, social security, where it comes along with the gender-based violence and the other security concern. The gender-based violence, domestic and other forms of violence were discussed, and education also came in the discussion, because what we have seen that in many countries, they all started reporting that the situation in such a way is going that particularly the poverty level is going so down that many of the students may not come back to school, and particularly we know that how in many countries in the context how families is often divide about girls and boys and who will go to the school as girl or boy. So, and they compare with the poverty, that if the poverty is too high, so girls will not go to school, boys. So now again, linking that, so the poverty level is going down, so that means girls will not go to school, many of the girls, and what can happen to them is that reflection also came in many reports, like forced marriage. Then it can happen that under the name of forced marriage, the trafficking can also take place. So few things came as a challenge to the community, to women, community and government. The short term was food, health, and social security. The medium term, it came included education, and in longer term, food, health, social security, education, and employment. So just in the first step, people start thinking about what will happen with regards to food, health, and social security. But when we think about social security, we can easily understand and get that social security was basically thought by women and girls in general, because their food security doesn't mean it's only food security, it's also coming with the social security. The other thing is that when we talk about women in a feminist idea, now we have to think that women are not homogeneous group. There are differences in women: pregnant women, lactating women, newborns, family-headed household, adolescent girls, refugee, internally displaced person, migrants. So all these dynamics actually come in the discussion when we try to focus in a feminist approach. So access to COVID-19 information, this data is from a few countries in Far East Asia and South Asia. So where we can see that with regards to information, not all the countries happen the same way. Not all the countries happen the same way for women and men. Basically, when the country contexts are quite like conservative, that the information flow is not same to women and men. basically it goes to men, and then they share with the family members. And many of the women are not actually in contact with any of the information. So this data we received from our Action Against Hunger Lebanon office, where they try to show that how the impact of COVID on respondents' lives. So if we see that how they try to really link with some kind of information like movement restriction. So some of, in many countries, the movement restriction was for like kind of imposed. Some people started from their own, and some people couldn't do it, and it's less because of the employment or income generation activities. So in many countries, even it was imposed, but people couldn't stay at home because they had to confirm their food and income. So a few examples that we received, that how when the safety, security, and gender-based violence, what we have seen so far, because of the restriction, because of the food insecurity in employment, I mean, when they lost their employment and income opportunity, there are so many cases that we found because of those situation and gender-based violence. So in Bangladesh, like about 306 rape cases reported in 1 month. In Ethiopia, this is a bit different. 101 girl raped by their family members, as they reported. So all these things, actually, I have given the references that from where I got all this data. In Ghana, adolescent reported about trading sex for food. Afghanistan already sees a high level of domestic violence, and in a few different data we have seen that women said about 79% women reported that it increased. And another survey that is done from Oxfam, they said 97% of women reported that gender-based violence has already increased because of the COVID-19 situation. Another context from India that we have seen, that they received about 92,000 calls, more calls compared to their previous months from the children. So it's like it's increased like anything because of the lockdown, because of the family members who used to go outside for many reasons, and they are now at home. So the increases of violence is impacting because of their staying at home. We are not saying that people will not stay at home, but it has definite impact to the women with regards to domestic violence, with girls particularly, where risk increased of sexual violence and abusing. So here is another data, we have seen that in France, that 30% have been increased, reported about sexual violence, domestic violence. In Cyprus and Singapore is 30% and 33%. In Argentina, 25%. So it's like increasing of violence against women and girls because of COVID-19. And this data is from UN Women. So now I will invite my colleague Aminata Ba, who is the Regional Gender Advisor for West Africa. So she can talk about the West African situation. Aminata? Aminata, your microphone is mute.
Can you unmute? There you
go. Okay, sorry. So thank you very much, Neema, for the introduction. Here in West Africa, I will talk specifically about food insecurity. And as you know, there is a pre-existing food insecurity in Africa, particularly during the lean season. You know, during the lean season, it is raining and people do not have enough food. So during this period, usually humanitarian actors are providing food assistance. And for the COVID now we have more than 50 million of people in West Africa, West and Central Africa, who need food. And this was about 20 million usually. Why this happened? Because, you know, there is a lockdown impact on informal work, and market was affected. And even if the government tried to provide food, they could not reach all people in need. So there is a very, very, very urgent need for food income. GBV increased somehow, but we don't have so much evidence. I think this is due to the lack of access to mechanisms, to compliant mechanisms as hotline and so on, because the COVID created less access to services. Now people are afraid to go to the hospital. They do not want to be contaminated by COVID. So there is a lot of stress in families, lack of mobility. People are staying at home. And we know that when people do not have food, women tend to have bad coping mechanism. High risks also are noted for people, refugee, internally displaced minority, people with high risk of GBV. So, yes, I said as well. How to move forward? For now, we know that providing immediate food assistance is necessary. That may be done by cash, voucher, or this will be help household to compensate their loss of income. Support also the economic recovery by providing input for value change and income generating activity. Also investing in hygiene infrastructure in market, because we know that during the lockdown, the market will close. And when markets are closed, people and women cannot access to the basic item like soap, like oil, and many women were very, very impacting and not able to fulfill their basic right. Also, when we open, market are opening now, but we have to improve infrastructure so women can go to their activity. Also invest in out-school COVID-19 safe activity for young women and men so they can be more active in the community response. As we know, women are part of the response, and we have to help them fulfill their leadership. Okay. Okay. Addressing GBV, but we know that we have to ensure adequate and appropriate prevention of response measure around GBV, essential services, including continued access to GBV services. Ensure hotline are staffed, because when if hotline are here and there is nobody to respond, we cannot yes, we know who are affected. Also provide psychosocial support. Maybe a mobile clinic may help to find people on their community. support also the implementation of safe space where women can, which are adapted to women need. Okay, this is as a general constat in West Africa. What we know that the COVID created more problem, even if in the sanitary situation, Africa was less affected. West Africa was very, very, very less affected than other countries. But the impact is on food and socioeconomic GBV, food and socioeconomic impact. And that may lose all our effort that we done during the last year to make women more autonomous, more resilient. So this is now a socioeconomic and a crisis, and we don't know where we are going. Okay, thank you very much. Naima, over to you.
Yep. Thank you so much, Aminata. So now I will go to the next slides to see that how this impact of job loss particularly created situation for women, girls, and the marginalized community. The recent initial assessment of the International Labour Organization, almost 25 million jobs could be lost worldwide as a result of COVID-19. So there are different type of jobs for sure. Salary job where there's service industry involved, health and frontline workers, education, private sector, non-salaried job, day laborers, domestic helpers, migrant workers, women in sex trade. So particularly when we talk about that salaried job in the service industry, we see that at least 70% of women are there in the service industry, in healthcare and frontline workers, where the frontline workers, mostly 90% of the frontline workers are women in the health sector. If we see that the different level of employment in the health sector. Education, basically where we see that who are the people mostly in the teaching profession, in the primary schools, secondary schools, then we can see that it's a huge number of women who are involved there. In the private sector's job, there are involvement of women in many positions, and particularly we'd say that industrial jobs, the garments industry, so on. There are non-salaried jobs where women are also involved. Day laborers and domestic helpers, like domestic helpers mostly are women. Migrant workers, there are men, women both, and it has definite impact because many of the countries already, they send the migrant workers back to their home. Women in the sex trade have definite impact in their income level with regards to, because of this COVID-19 situation. So if I take an example from Bangladesh, that we can see that how proportion of people who worked fewer hours or lost their job since the spread of COVID-19 by 6 and informality. So we see that formal employment, we can see that it's the majority of women who actually in a situation, and the decreasing of male and female, that how it's in informal employment, it's almost same, but if it is formal employment, then we can see that there is a big difference between men and women. Impact on women's security, internally displaced people and migrant workers. Many of us know that there are some measures taken by some of the governments that has, those are fundamentally discriminatory. The Labor Department of Hong Kong appealed to foreign domestic workers to stay with their employers to reduce the risk of the virus spread in the community. So domestic workers, they had nothing to say that, or to refuse to stay in those households, otherwise they could have lost the job. So implementation of lockdowns without any measures of social safety nets. So before, as I said before, that it was a kind of sudden thing with shock. So there is no sort of measurement was taken with regards to safety nets, posing significant risk to refugees. I mean, no plan. Internally displaced persons, urban poor communities, and other extremely marginalized sectors leaving no food on the table. In this regard, I would definitely try to bring the discussion of people who are in geographical marginalized area, people who are politically marginalized, people who have physical or mental challenges, difficulties, disabilities. So those are the people who were never in the discussion. People who are from the LGBTQ community, actually what we have seen that many of them even didn't get a chance to get a relief. And they were kind of socially marginalized people, culturally marginalized people, so they didn't get the access. So further politically motivated sanctions, continuation of war, or certain countries as they are hit with the pandemic may tantamount to genocide. So if we think about politically motivated sanction, of course, there are examples where maybe the leading parties are, leading party is not interested to support the other people who have different opinion. Then the war-affected countries, what we have seen that without having any proper plan, and all this shutdown and lockdown has given them in a situation without food that they are remaining. Autocratic states such as media censorship or declaration of emergencies with heavy military presence in violation of international human rights obligations at this time of crisis. So these are examples, not maybe not in the countries that are who have kind of democracies, but there are many countries in examples that media censorship is there. So there is no news can come with regards to COVID-19 situation, what is happening to people's life, how it's spreading. So those type of things actually creating extra pressure, extra situation for women in particular. Some kind of example that I would like to bring with regards to increasing of GBV risk and vulnerabilities. One is sex trade for food, forced marriage. It's a forced marriage, but again, if I link it, the next one, the trafficking under the name of marriage. Maybe we can think, is this situation is also, we need to consider that it can happen. Yes, it's happening. If I think about Bangladesh, in the rural area, it's increased in last 3 months about forced and early marriage. And most of those marriages happening where people are coming from outside. So this, they are coming in the communities and taking the girls. So child abusing is there. Because in exchange of food, sex in exchange of job security, sex in exchange of day laborer opportunity. So I need food, and that is the end. So changes in the economy in last 4 months, examples from Canada. So what we can see that it's like the 9% annualized drop in consumption spending was the post on records, as Canadians were forced by confinement to save. The savings rate actually climbed to a 19-year high, which is 6.1% in Q1. So there we can see that in 2021, Q1 GDP has gone down. If we see that has happened like 2009, and now it's quite near to that year. And also we see that labor market under pressure. So that's where we can see that it's dropping, and how part-time and full-time both jobs are a bit in a challenging situation. Many people lost their job, and we know about that government measure. But if this is the situation in Canada, there are so many countries in Global South where government do not have that measure to support people with regards to cash support or any sort of social safety net planning. So basic changes happened in employment and labor market. The pandemic has also laid out in the open and fragilities of the real sectors, agriculture, manufacturing, and services. So what we have seen so far, that how agriculture, we think that is, it's working very well. Actually, we have seen that it's not actually working very well, because we lost our attention to agriculture because we shifted our attention to some other things. So the food security that initially can come from the agriculture sector, that has shown that it's fragile. The manufacturing and manufacturing sector is mostly closed. So we have seen the fragility there. And the service sector, that particularly with regards to health sector in Global South, is really in a situation where people are waiting for weeks, 7 to 10 days at least, to just to go for COVID-19 tests. So this fragility we have seen. The growth of GDP will further drop due to further weakening of these 4 indicators stemming from the pandemic. The downturn will be swollen by income reduction, lowering savings, and hence declining investment sourced from savings. In many countries, the earning from remittance has declined due to the pandemic, and huge numbers of migrant workers returned from abroad. They are bound to return from abroad. So loss of jobs and reduction of remittance earnings will dampen consumer spending, in turn constricting the GDP, and reduction in the inflow and remittance will also hurt the rural economy. As I said before, that the agricultural sector lost the attention because of the possibility of migration as worker, and also industrialization in the urban sector. So if we think differently, most of the countries in Global South who are export dependent are basically in a situation because if we see because of globalization, what happened, many of the countries dependent on exports. They have they developed industries because of the cheap labor and low wage, and then dependent on the countries who can buy the products from there. So those export dependent countries are really in a situation where people are losing their jobs. If I say garments industry, where 75% workers are women, they lost their job. As the economy slimmed down, investment, consumer spending, and export will drop. Hence, high government expenditure is required to save of the plan. The prime focus is on the sectors relating to universal basic needs, on the retention and creation of employment, particularly because of erosion of income, unemployment aggravated by the pre-crisis high unemployment and underemployment due to job loss, growth, and shortage of skills. So, I mean, if I go in explanation again, that because of the attention in the service, less attention in the service sector, we have seen that service sector is not actually functioning well that we expected in this situation, and also the agriculture sector. And the sector that we give more attention is manufacturing, so on, is now almost closed in the most of the countries. Initiatives that may not count women in holistic approach. So now if we see that in the situation where a health sector, we have seen most of the countries are suffering. So now we saw that there are suggestion came from World Bank and IMF like that announced their neoliberal response in the form of new emergency loans targeting poor countries where the health systems are the weakest and people are most vulnerable. So this is something is pretty alarming, that loan is, when the countries are going such an economic crisis, and then of course trying to help the health sector is of course is positive, but how the emergency loan will function, that is the question. In fact, following structural adjustment programs, many healthcare and other essential services such as education and water in the region have been a target for profit making and subsequently privatized. Precisely why so many women and marginalized communities are failing through the gaps now. So many of the health sector that we know is privatized in many countries. Government health services are not really up to the mark because of the profit that the private sectors can make. So that is where they have invested. So now why we are saying about the feminist approach, where do we see women and marginalized in the economy? Agriculture, primary agriculture production support. So we see that women are there in the primary support. Historical shifting of agriculture towards capitalist interests, profitable for owners. So we have seen the agriculture, the focus from agriculture has been shifted to other sectors because that is profitable for the capitalist, and that is profitable for the many other corporates who are actually leading the globalization process for trade and market. So globalization is again the restriction to local economy. We have seen lots of local economy has been already destroyed, not because of COVID-19, but it happened from last 20 years where local economy has been shrinking, and that has and if we see that local economy was the basic sector that where women were involved before, so it offered us uncertainty and stress. So now people are losing job where they involve themselves, and there is no sort of local support as well. So it increased uncertainty and stress, created vulnerabilities and risk for women, girls, and children. All the situation is creating more vulnerabilities, destruction of environment, destruction of the relation between women and environment. So environment is one thing that we actually destroyed because of our interest to use the, actually to, I would say that we took as much as possible from the environment without thinking that what can happen in future and how we can think that our relation between environment and human being and I mean all flora, fauna is how important that is. We forgot that, so we destroyed the environment. And yeah, so luxuries without construction and basics. We started about thinking about that is the interesting from the capitalism, that where luxury has been promoted like anything, and we forgot about the natural environment and human relation. So we started thinking about luxury, and we didn't confirm the basic rights for human being, which is relation, which is safety, security, and health. And there is, of course, sick competition has been promoted, and that everything has created stress to women. So this feminist approach to plan for food security and pandemic situation. As I said before, that food security should be the first priority for many. Yes, this is the priority for many. I need food to live. But when we think about women and girls, food security comes with physical and social safety. That for food, I can be abused. For food, I can face violence. So we cannot actually separate food security and social security, safety security for women and girls in particular. And of course, I should mention about people who are in different contexts and with all their diversity, LGBTQ people, transgender people who are in vulnerable situation in most of the countries. So a feminist approach to planned economy is in a pandemic situation, women must be a part of decision making in national budgeting process, especially when urgent fiscal policies are made to respond to the COVID-19 crisis. So far, we haven't seen that much involvement of women in the budgeting process. Many of the countries are announcing their budget, but women are not involved. Many of the women's rights organizations are also complaining that they are not at all involved. So this is a main priority. The responses must be formulated with the aim to reduce inequalities, distribute wealth, and achieve human rights. For that, structural change is undoubtedly crucial. Family protection, childcare, nutrition should come in the first discussion. So all these things that under the package, we need to think about that mitigation, prevention and mitigation measure for should be free for all. It should not be something that I need to wait for to get the test, and I need to wait for money to do the test. So, but now if we see the global South situation, it's highly, it's a huge cost to go for testing. So another thing is that ensure social safety nets for all and move towards nationalization of all privatized essential public services. So we need to shift our mind from the privatization of services. We need to think about the nationalization process where people can ensure their rights. So just an example that there are so many insurance companies that is charging high interest rate for people to support with the insurance. So those things is really a harmful situation that has been created for women and girls in particular, and the poor and marginalized community. So with regards to the approach that I would like to say about feminist approach is to plan economy in a pandemic situation is feminist economics, where the economic structure that will serve the purpose, that will cover the responsibility to people, responsible and starts from the household level and considers all to include in the economy. So in capitalist economy, we see that how the market work, we have seen in last 4 months that it's actually not thinking about people. It's not it didn't consider the situation of people. In 30 years in Bangladesh, the garments industries are working and they couldn't support even for 2 weeks salary support to the workers. So the workers remain as it is. So it didn't actually involve the rights and justice and the changes of the situation of the workers. So we need to think about how we should consider each of the people in the household level, and we need to take the economy to the household level, that people should be considered, the human relations should be considered first. Make sure values enter economic analysis at many different levels. Non-market activities, power relationship are more important in economy. So when we think about power relationship, definitely it also reflects on the gender-based violence or any sort of marginalization and violence that can happen because of power. A gendered perspective is central to the study of economics. Human beings are complex and they are influenced by more than just material factors. People compete, cooperate, and care. Government action can improve market outcomes. The scope of economics must be interdisciplinary, so it should come across in a holistic approach. So as I said before, that health and social safety, these things should be the first focus, and the healthcare, the family support system, and also thinking about the differences of people, differences in community, infrastructure, everything needs to be highlighted. So many of us are familiar with gender responsive budgeting, and I would say that this we need to think about inclusive gender responsive budgeting at this period, when the countries are thinking about how to overcome the economic recession, how to overcome the situation of the lacking of income opportunity, we need to think about that. We need to understand the situation is not same for everybody. Situation is varied for one to other. How we can analyze those situation and policy practices and identify the need, and where we should invest, and thinking that food, health, and the basic needs should be ensured for everybody. So agriculture and food security, again, said that there is huge investment needed in agriculture to make sure that we have basic access to food. There are many things that we can do about crop diversification, introducing new technology where government can invest more to identify the technologies that can help the agriculture, so that we can ensure the food security. We should discuss about the fair price for the farmers, and that is mostly in many countries that is a major lacking. So if we think about that, how we can involve the people in green revolution, in diversification, and nationwide rural and area regeneration of industrial fund, then we can establish a drive much needed changes. So now what we have seen that sources of revenue has been dropped in most of the countries. Value-added taxes has been dropped. So we think that there are the major gap that government is experiencing many of the countries. So they are thinking that how they will revive. So what we believe that in this crisis that attention to GDP, increasing GDP should be shifted because now the emergency situation is mostly to help people, to think about people's lives. So we need to think about short, medium, and long-term approach that will include all women, girls, and all. And the current crisis is a reminder to the long-fought demands of feminist and people's movements for the development, justice, and an opportunity to realize the elimination of wealth, power, and resources that create inequalities between many. We see that urgent need to seize this moment of galvanize our collective power and realize human rights and fundamental freedom. We acknowledge and prioritize that gender-based violence is crucial at this point because of food insecurity and loss of income, and this has to be prioritized in the planning process. Social protection such as unemployment support, social housing, and universal basic income. So the world has sufficient wealth, that is what we believe, to execute this, and it only requires the political will for implementation. We should look for collective action and coordinated response to overturn the current dominant rules and rewrite one that is feminist based on the principles of human rights, historical responsibility, accountability, international cooperation, and solidarity. Feminist and people's movement must be at the center and lead this pathway. Yeah. Thank you.
Thank you, Naima, very much. And Aminata as well. Is Olivia or Katerina, are you guys moderating the Q&A here?
Okay, so I got one in the chat box. Yep. There is
I see
there is a link that's shareable with others to have access to the slide. I will share the slides with all. Yeah, that one I will do. And also the sources from where I got all this data, definitely will get that. And mostly the data came from the Action Against Hunger missions around the world. And also with, many of them came from the development practitioners. So we got this, and many of the newspapers also helped us.
It's great data. Thank you so much. I see that Christine Appio has raised her hand. Christine?
Thank you, John. Thank you, Aminata and Chaudhry for the excellent presentation. I definitely agree with you that the COVID-19 impact will actually pose more risk for women and girls post COVID-19. You know, looking at not only trafficking increasing, but also the cartel or who are involved in trafficking, like thriving through. One of the gaps I've seen is that given the fact that the COVID-19 response is strongly led by the government, even in countries where there's humanitarian crisis, there seems to be a gap in coordination between the government-led coordination mechanism for COVID and then the humanitarian coordination structures, which in my view has created even more problems, because including having COVID-19 plans that does not actually reflect how it's going to address risk, some of the risk. Just citing food distribution, giving an example of Uganda, where the government announced that they would only distribute food within the Kampala urban area, the capital city, to people who have lost their jobs or who are on lockdown, or for one reason or another, feeds from hand to mouth. So the challenge has been that not only has the process been hampered by the bureaucracy in the state system, but it has also been affected or hindered by the corruption, in the systems that delays the process. So what we're seeing is, we have seen women going to the street to actually look for food to feed for their children, and instead they're being arrested and taken to prisons. We have had that cases several times in Uganda. So I think there has to be also a conversation in terms of how humanitarian and development actors can better work together post-COVID-19, but which has to start during the COVID pandemic response, to actually try to see how to collectively address, some of these risks that we are foreseeing. Otherwise, I see we might have a situation that will get fully blown out, and which will go beyond the existing capacity to respond. Thank you.
Yep, thank you very much. And I fully agreed with you that there are situations happening in many countries where people were arrested, people were harassed, but they didn't have the food in their home. So what they should do? And humanitarian response is also like the organizations, because of the lockdown situation, many organizations are not, it's not possible for them to coming together and also plan together. But of course, there are lots of initiatives that they are trying to do really, and they are also influencing, trying to influence the government in the planning process. So definitely there are lots of room to improve, because people are dying, and we have to make sure that that there is the coalition works very well, and the coalition is active and bringing the situation of people, so they can amplify the voice of people. So that would be very helpful in the planning process, and government should listen to that as well.
Great. For Aminata and Naima, there is a question in the chat from Kara from Global Affairs Canada, and it says, with a shift towards addressing the secondary effects through the provision of food and cash, do you have suggestions on the top 2 advocacy points to raise with partners delivering these services? I guess delivering food and delivering cash to ensure that GBV is prevented and mitigated. So how to deliver those services safely, a question for both of you.
Aminata, do you like to say anything, or? Yeah. Okay, so I think that with regards to cash support, which is really important, but and a good initiative for sure. But we also meant to make sure that we can check the corruptions. There are lots of examples where government is supporting with cash support, even food support, but those are captured by the local political people, local powerful people, so those are not really going to the people who are in need. So we need to think about what are the measures that the local government can take with regards to make sure that it goes to the people who actually need them, and also identify women, women-headed household, single women, LGBTQ community, disabled community, all those things. So that's where I focused on that, how the budget process, because these things are coming from certain budget process for cash and any food support. So that budget process should include that analysis of people's situation, who is going through what. So that sort of identification is important. Going beyond the political sort of separation argument that this is the situation and we need to stand beside the people.
Great, thank you. There's also, do you see in the chat, there's a question from Ocha. It's talking about that in the context of refugees, where many call to action partners work, how can humanitarians have a more feminist approach to food security in the context of COVID-19 and consider the heightened risks of GBV? So thinking particularly, for example, about situations with refugees or internally displaced persons. Do you have recommendations for that?
Yeah, so thank you very much for this question. And this is important that most of the, if I think about the camp-based refugees, there are definitely people who are working closely with them. So how to involve them is important. So in this neoliberal capitalist structure, one thing is really we need to think that how we are working with the refugees, really helping them for their resilience building. And that is what I think that is the suggestion that I would like to include with other operations that we are doing in the camp settings. So how they can survive, how they have certain area to be there, but what are the empowerment process that we can take for them? What are the skills development in this situation that we can help with them? So it's not always dependent on the donors, it's not always dependent on the humanitarian organization, but it also can develop their own resilience for their survival. If we see the data in Syria from Save the Children a few years ago, where people, the girls are, they had to get married to people who are going from Middle East with lots of money. So that really required that sort of exercise to building resilience for safety, security, understanding, knowledge, and all those things, and it will support the total empowerment process. We need to think about refugees who are, I mean, we are calling them refugee. They didn't name them as refugee. So they didn't leave their country by willingly, for sure. It's forced. So how we can think about to rebuild that sort of resilience in them, how we can support their mental health and physical health as well. So that is one thing that I would definitely suggest. Along with other activities, we need to focus this area.
I'm seeing that it is almost 1 o'clock. So if there are any other questions, ask them now. Let's see. Complicated, and I meant to look at the chat, look at the hands, but it looks like we covered the questions, immediate questions that people had. And then there was so much in this presentation, but as you said, you'll be able to provide the slides and everything will be shared with everybody, right?
Yes.
Okay.
One thing that that I brought in the discussion, which is feminist economics, the emphasis there, and the inclusive gender responsive budget. So this one I would again emphasize because it's very important that we need to think about how public expenditure works for people, how public expenditure actually really reflect on people's situation. And this is one of my research that I did in 2018 with the support from Code International Institute and Global Affairs Canada. And I can share this one. And this is also a webinar is already there on YouTube. I can share that one. So you can see that step by step that how we can develop the not only gender responsive, I will include inclusive, so we'll not miss anyone, that how we can think about bringing people in the economic, in the discussion of economy.
That'd be great. And so I think probably on behalf of all of us that participated in this, may I thank you and CBN Aminata as well for your contribution. And it was great of you to do this, particularly after a long morning. And as I said, so much good information shared. So many, many thanks to you both. And I guess we'll see one another tomorrow too, yes?
Thank you very much.
Thanks a lot, Aminata.
Thank you.
Okay. Okay. Merci bien. Okay.
This was a long presentation, and thank you for your patience and all your support to us.
Okay. Take care. Okay. Bye. Bye.
Thank you. Bye.